We get calls every day from cabinet. What is the sanitation cabinet today? I don't want about this story as of June 2023. It's no longer works. Okay? It no longer works. You know, the other time we went somewhere and they were asking us, what is the level of the water at when it falls down? We need to know this. 1 meter above the 1966 level, data has become a big issue. So I want to leave you with those thoughts. And like I said, as a ministry, and that is probably maybe I'll tell you this later, we are very serious in ensuring that we try to meet the targets that have been set by ourselves, Vision 2040, as well as stick to the signed to agenda is concerned. So we are with you. We can't do it alone, and everybody's efforts will count if this country is to achieve the goals that we plan. Thank you very much.
Thank you so much for provoking us to think critically about data. Now is the time for our first presentation. Please kindly someone in this projection from OPM. From OPM.
Good morning once again. Yes, my name is Issa Kaunde, the Senior Policy Analyst, the Office of the Prime Minister, the Directorate of Strategy Coordination and Implementation. The SDG falls under our directorate. They do the work. So I'm here to share with you the little we know about SDG 6, because we know Minister of Water is the lead. There's a lot of information about SDG 6. Our inputs normally come from Minister of Water, the data, Minister of Water, who was to do the implementation. One is just to do the implementation. So the disclaimer first of all is on the issue data. Was from the discussion of we denoted a clash. Show data. My clash on the show data. My clash on the show data. Because the what I'm going to present is what we presented yesterday. SDG in the SDG conference. So we have a progress report. SDG has not been done. Now, so they're implementing SDGs in 2015. So I've been done. That's what we have. So that's a disclaimer. Data. Commissioners raised a lot and talked about data in the previous speaker about data. So that's where we are. So can we continue? Is a group presentation. Action. Beyond the police and military environment, they key highlighted progress we have so far made. How SDGs are connected. We are looking at how these SDG 6 influences others or how others will affect it. It's not detailed, but as we go along, we'll realize that SDGs, you can't separate them. Find their indicated SDGs 1 to up to 17, but it's very separate them because one supports the other. When one is not facilitated, the other will activate. So then also we are looking at the new emerging issues, SDG 6, then possible recommendations. That's how brief the presentation will be. So in the introduction briefly is when we started implementing the SDG. So in 2015, this the 2030 agenda informs and guides the we see the development plans. So we see that the RNA level is SDG. So we customize our development plans, relation to SDGs, as you know. So we have setting goals, 169 targets, 231 indicators. That's for the case of Uganda. So most of these targets are indicators launched a ways ago. So what I'm going to say is that's the introduction. We have 17 goals, as we are all aware. Those are the targets and indicators that apply together, that are all together. But for Ugandans that are applicable to Uganda, we have 201 out of 231. So the indicators with data points, we have 127 out of 231. So for the entire SDGs, not for the SDG 6. So let's continue. So Uganda, like any other country, has done the voluntary national review. So this is not all countries, UN countries are doing the review. But we are one of them. So we are going to be presenting these reports in New York. The dates are there. It will be from July to 17th. I know Minister of Water, he has a delegation. He will also be present among those delegates that will be representing our country. So what we are doing here, the reports we have are going to inform the discussions that we are going to present in New York, effective 8th July to 17th July 2024. So let us continue. So we see that we have got a number of reports that you have submitted. We have this launched yesterday. We have the progress report of implementation of the SDG development goals. So all these are informed by the review was informed by the first and second BNR, the status of implementation of the development, the sustainable development goals. And so we have this is the key report that we present in New York. Let's continue. The progress on SDGs. You are looking at the key enabling environment that is enabling all the SDGs. That's enabling us to achieve how do we implement the SDGs around all the SDGs, the 17 SDGs subscribe to. So let's provide. So we have the institutional and SDG validation mechanism. You see the apex is scrambled, so we have it comes down. But the SDG secretariat is about secretarial and the strategic works in all the various stages of coordination. So you realize that OPM will not work. It is you who do the work, it's the CSOs who do the work, it's the partners who do the work. So without this structure, we cannot be anywhere because we don't have the capacity in terms of resources and the time to do it. So we rely on mainly our partners, the ministry, the CSOs, the youth, and everyone to achieve this targets, the highest evaluation mechanism. It supports, gives guidance, what is direction and how we should move. So that's one of the key points in the learning environment that is supported with the implementation of SDGs in our environment. So let's continue. So now we see that SDGs, the other learning environment that's helping us to work with to implement SDGs. We're seeing the NDP 3, the way they aligned. NDP 2 was aligned at 70%, NDP 3 at 90%, and we strive to ensure that NDP 4 is aligned at 100%. So there's one thing I noted that we cannot separate SDG from what we do every day. So it is like the PDM, apart from the financial inclusion pillar, that involves giving direct cash, but the rest of the other pillars of PDM are what we do every day. If it comes to social services, the water, the roads, are what we do every day. When it comes to NDP 3, when we are uploading, whatever we are doing is SDG. So the report is indicating that 90% of our PRs are aligned to the SDGs. So 90% of our NDP 3 was aligned to SDGs. So now with SDG4, NDP 4, Commission has stated, we are striving to ensure that whatever is in the SDG is, but we know the concept a bit too big. I don't think we can, but we shall try at least we can say that about minimum, maybe about 70. But you know the SDG goals are too huge that countries like we might have challenges in achieving them. So that's the other enabling environment that our development and planning frameworks aligned to SDGs. Let's continue. So we have SDG localization and transformative actions. So the localization is about taking the SDGs to the lowest of the lowest persons. We don't leave it at the center. So by taking it to the lower, people appreciate what SDGs is, what is expected of them, what is expected of every other stakeholder in the implementation of SDGs. So that key enabling environment has helped us to implement the SDGs. So let us continue. So we have the monitoring and reporting. So when people are aware that there is monitoring and reporting, they strive so much to implement as per SDG. So those are some of the reports that have been launched. There's Level 1, Leave No One Behind assessment report, submitted by UN. Then there's the second SDG midterm progress report, the first SDG progress report, second. All these are on the website. I think I'm going to go. This second SDG midterm progress report is announced by the rest of the website. So by having monitoring and reporting is one of the environment that is pushing all of us to do what we're supposed to do. Want to know honor to see that this sector has not done its role. It's really bad. So it is pushing all of us to move together. So let us continue. So now progress on SDG. This progress is basically a smaller progress. The data like I've told you The data what we are going to present is what we presented yesterday. The progress on SDG, let us continue. So that's our goal, ensuring availability and sustainable management of water and sanitation for all. So I will pick out one of the key targets is by 2030, we should achieve universal and equitable access to safe and affordable drinking water for all. So what indicator do we have? Proportion of population using safely managed drinking water sources. So that is our goal since. So another target is by 2030, we should achieve access to adequate and equitable sanitation and hygiene for all and end open purification, paying special attention to the needs of women and girls in vulnerable situations. Then the indicator is proportion of the population using safely managed sanitation services, including hand washing facilities, soap and water. So we realized that there's a report of the minority no one behind the minority report. It indicates the gaps that SDG 6 is having, the number of areas, like it gets price spends, especially in rural areas, accessibility of water is hard. The water people should come to law. We look at the minority ethnic groups like the Bandua and so on and so on. So by that, it indicates that we have something that we have to strive one to ensure that we achieve that goal. So I don't know. So on water supply, we are saying the proportion of the population using safely managed drinking water in urban areas. We have 72.8. I had you that someone was presenting about 76. So perhaps we have rural at 67%. Then sanitation and hygiene, by 2030, achieve access to adequate and equitable sanitation and hygiene for all and end of identification. We are saying that the proportion of population is safely managed sanitation services. In our areas, we have 41% those who are having safe water, having safe sanitation and hygiene facilities. Then in rural areas, we have 8.1%. So maybe if I can pause there, is I will see the variance in the data of the same. So like the potential out there, I'm voting from UBOS. Most of us is UBOS and I don't know whether it's from what you presented. You're part of the committee that was doing the data review of the SDG. So the issue of data, that's what we presented inside. So if you have any so that's what we are saying. The issue of data is very challenging. We are reporting different data. I think one of our key people should not issue that we should have one set of people. Because I'm now realizing in water, we have enough impacts. There are a lot of work. When our government is doing a lot of work, so that's the challenge we have with that. Sanitation, we have 31%. It's also different. 4 hours is high. 6 hours is high. That's the So, waste and water quantity. We are looking at proportion of wastewater managed treatment at 4%, proportion of bodies of water we put ambient water quality is at 1%. So the key outgoing initiatives to achieve the goal the government is making is as many efforts to mobilize and coordinate stakeholders in the bush subsector, strengthen partnerships with stakeholders, including CSOs and the private sector. We have so the next steps is mobilizing resources to finance the bush sector, water compliance with permit conditions water permit. So with because of that, also the deployment of coordinated nutrition, we realize in case we don't address most of the wash issues, we end up burdening government to finance Ministry of Health to treat diseases that would have been prevented. So we really advocate Ministry of Finance here and others. Let us impact over the preventive areas rather than treatment of the body. Prevention rather than treating area. Because the nutrition look at use of water basic people in ensuring that we have the wash facilities available. So this is a key area of concern that we look at. By the time we say use of it does not have available drugs, each party should have a health center. If we address this, we have need that huge expenditure on which curative site. So Ministry of Water and partners look at wash as a very, very key area that needs more support. So let us continue. So I'm showing the production, oil production and supply from 2014. The blue is the production, then the maroon is the supply from. So we see that we produce a lot, but we don't supply all of it. From 2014 to 2021. So there's some leakage somewhere. And we find that some areas we complain there's water shortage, but you see the supply is not much with the production. So let's continue. So here, is that still now we should go data. So here we reported that 79% of households accessed water as of 2021 in the so we don't have the current data. Now, the situation we are reported it in our report. But we are saying that we have approximately 5% of our households have facilities. So, okay. And we are saying 21% of the population are using simply violent sanitation services. So it gives a lot of worry. Another one in the data, because now we are now in 2024, but we're still reporting 2021. The 5% households that don't have toilet facilities. So a very huge health issue. We should all work together to see how we may not construct for them, but we should also have the mindset change within our wash activities, the mindset change. Honestly, the 5% is too big and goes very forward for years. So this is what you. So that's the key highlights that we picked the progress of SDG 1, SDG 6.1 and 6.2. So yeah, I was looking at how connected are the SDG goals. Like I told you, it is very hard to separate the SDGs. They all move concurrently. So most especially those under the planet, anything to do with water below, life below, life on land and what. Those ones are too close to each other that you cannot separate one the other. So if you don't conserve, the environment, you will affect the water sources. If we have climate change and mitigation, we don't adapt to climate change mitigation measures, we'll see we shall have our flooding and we shall contaminate our water sources. Sustainable resource management, how do we use our resources? Water. Find people are harvesting, mining sand, which is affecting our water. People are using wetlands which are filtered, which are meant to filter our water before they go to the main water reservoir, the lakes. So if we don't work together with other SDGs, we shall not achieve our SDG 6. Then environment pollution. A number of us, a number of industries, a number of, we see there's improper disposal of the waste into the water sources. The vehicles, our vehicles will get a bit older. Maybe the one I came using is too old. So we are all culprits that in case we don't work on other SDG goals, we shall not achieve SDG 6. Then we are looking at this sustainable organization. Because with the growing population and the land for use is reducing every other day. People are now approaching on the water sources, on the environment, which in the end will affect us to achieve the goal of having accessible water by doing that. So we see partnership. Others are really thinking about partnership. If you don't have partnerships, you don't have partners. You don't have partnership, you don't have government financing, you don't achieve because all of our goals, targets, and indicators need to be resources. Either financially or by having human resource or having mindset change programs. So we see that once we don't synergize among all the SDG goals, we shall not achieve. So I see we are supposed to connect all our SDGs to achieve. So that's why you see that we need to support each other. You should not say that I'm in SDG 6. When there's SDG or another SDG, say SDG 1 and hunger. Because if people are in poverty, extreme poverty. So in case people are poor, they're going to approach on our environment, they will plant the trees which will help us to the rain and so forth. So I see there's a lot of linkages between all the SDGs. That in case we leave one, the other will affect the other. In case we support the other, this other will automatically happen. That's why now the government thought it wise that we should have the programmatic approach where all stakeholders are contributing to give an output. You bring them together, you say for you, your work is to to bring the water to the garden. Then for me, mine is transport to the garden. So what do you need? So that we don't work in silos, work as a group to achieve the given goal. So let's continue. So but now we're looking at the emerging issues that are affecting our SDG goal and SDG goal 6. It can also affect the others. So we are looking at the Uganda refugee response, that we have got a number of people who are coming, that they are constraining our resource. So we are saying in future we shall have to fight, like you say, we have to line to get the water. The water is rationalized. The time you get maybe 1 jerrycan, sometimes you see which is not applied. Every piece the toilets or what is rationalized. So you might see that with our refugee response, if we don't handle it well, we shall have other requirements. So one of the key emerging issues that when we are planning and programming, we should look at the refugee community. After the refugee community, look at the refugee host communities. Because we have got reports that most partners, they only focus the refugee communities. Then they leave the refugee host communities. So which is really not good and will not enable us to achieve our SDGs. So let us continue. This somehow survived the beat, but our neighbors in Kenya, and really it's fine how we suffered, but not good at this somehow. But other areas still experienced such floods. There was a lot of heat, and when you have heat, the water level was reduced. But maybe with floods, the effects to the water sources. And so climate change is another emerging issue that we should look at, as well. Should also have a component of supporting the other programs, the NEMA, the NFA list. As you are doing some campaigns, you provide maybe seedlings, you work in partnership with the other agencies. In the scenario when we are doing the midterm review of the manifesto, where we would go to, we wrote a letter to the Ministry of Water, expecting them to coordinate all the other agencies and the name and what everything. And when you go, so they didn't give us the data. Why? They say they are saying you should go to them. We should go to them. They have their own accountability. So I see we should see a way we support each other. Should see when we support each other. When them is fighting with people who are coaching on wetland, we should say it's neighbors business. We should say we'll supporting them one over the other. Because as we say, climate change affects. They say that it affects not only and someone, and also who intentionally destroy it and also unintentionally destroy it. So when it comes, it affects all of us. So we should all have that in mind, that if it is heat, whether you are polluting or you are not concerning the environment, all of us. So that is also one of the key emerging issues that we should look at it and see how we address so as to achieve the SDG goals and our SDG goal 6. Yes. So we have recommendations, but the recommendations, they might not be as you might desire.
It's okay.
Yes, so we shall also see how we modify them in our next elements. So you are saying we should optimize the economic, social, environment and political benefits arising from cross-boundary cooperation and its benefits to nature, and you are in flexible cooperation according to challenges and concerns and advantages all sectors between human development. So, by this we are saying, let us look at the economic, social, environment, and political benefits. We don't expect politicians to say because elections are soon coming, let us leave the environment, or let us leave such and such, because we are fearing to lose our political seats in the forthcoming elections. So whatever we are doing, let us do, knowing that we should optimize the benefits. If you are harvesting from, say, a water source, look at the sustainability of what you are doing. But the challenge we have is that most people, they mind about today, they don't think about them, they don't think about others. So once someone is okay, everything's okay, but that's not the case. Because when things are not okay, you know, one way or the other, it's going to affect you. We had an engagement with one of my contractor. That is something that the client shall see the effects later on. The roads, when we are constructing the roads, we use systems and them. So when we make our roads within 3 years, that's another. So then go to HT, now we shall have to report those problems from other countries. Those hours will be done if you're skills. They will be done. So I just imagine, okay, let us not imagine, actually, okay, you're constructing a road in Kasese, and I'm supposed to come for the ground from home. So the cost, you see that. And once the work is done, we shall see that who has let us go to Kenya, so you see. So that same applies to the environment, that whatever we do, whenever we're doing something, we should go. Most of us, we don't care. All of us, including me, don't care. Just want to say, how is I going to make it? Once we are constructing, let's go to the bank, they don't mind. So two, we're seeing incorporating an evaluation of the impacts and vulnerabilities associated to the sanitation strategies to Uganda Action Plan, climate change, as I said. This serves as the question measure of value sanitation approaches. So this is key, not only to Uganda Action Plan and climate change. We are also developing the Uganda Nutrition Action Plan form. Three. So we are seeing that we should look at all these vulnerabilities that are associated with the sanitation challenges. Should incorporate them in our engagements. So we're interested we're interested in the use of water, because most of us, we can't live without water. We can live without power, we can live without sugar, we can live without other things. You can even see if you can't afford it, you can live without it, but maybe a water. There's going to be restaurants here and find there's no water. Maybe let them go back. So also the things when we are doing should look at them in terms of it is not there to happen, and water is key resource. And we advise that this every day you take about 1 liter. 2 liters. But we hardly take with a liter. Most of us. So let us go further. So we are seeing enhancing the existing water source infrastructure to ensure consistent water supply and reliability. So we are saying, like the commissioner said, that our emphasis is constructing more, and very few efforts are done there. What was constructed, like when we are building one historic estate, we also for information about number of bounds. But the information for the existing bounds is available. Those that are down is not available. So, and it is challenging that we are more constructing, but we don't do the repairs. But the government supports districts with the repairs that Minister of Water should bring. We moved to the number of irrigation facilities. Most of them, Minister of Water constructed. Then we have the, I don't know, they have got the chance to advance some of the irrigation, how many irrigation facilities that we are donated to, that we are giving to the communities. Most of them are pushing, you find an irrigation facility or that hosted some region of money, only used by 1 to 3 people. So the government should formulate a precise policy objectives to steer funding and financial choices, quite well budgeted funding and financial strategies that apply public expenditure on wash. So funding is key. You should also know accountability. You should know where you have done, what you have done, what have you done, and so forth and so forth. Then, lastly, we should be made to enhance the availability and accessibility of data. I don't have been in the past, but it's said to write it down. So data. I think that matters. We should see how we. I don't know if you have open possibilities. So I think I should get about that. We see the issue of that. Because it's discarding. We will have other discussions, maybe sessions in New York. We have a report, but the data is what is and most of our partners, when you see the consistency, that is so much. I know we're doing a lot of work, partners are doing a lot of work, and we still need their support, but the issue of data, because now we don't know which areas are really globally of the other. So you might find we don't have that data. So we should have the data, should support the secretary in providing data. So I think that's the end of our presentation. So that's what we presented yesterday. That's what's in the midterm review performance of the SDGs. So part of it is in the report of the Leave No One Minority Report. So whatever that you see there, you can see how and what and harmonize. But I don't think it is too late. I harmonize the data sources, see what as one government. I think another take home as we go for the SDG conference, we should see how we harmonize our data. Should see that head of delegation, the data the head of delegation has, the same data we want to have. But we don't have so basically this is how we see or how we saw that SDG 6 is performing the details and the reports system in the website. Where yet the one of the monitoring, that monitoring report and the interview, I think it's not yet uploaded. So with that, back to Slovenia, and so we can move forward because we're experts. So thank you.
Data. Don't you remember just take data. I think it's data everywhere. We really have to, come to that level. Thank you very much for, giving us an opportunity to see what's happening at OPM. And I already had a few people chuckling when you mentioned, when you wondered whether this is the same data that we had. I had some meaningful chuckles. Members, how does this align with what we have and what we know? We can have a quick reflection and then add OPM to our list of of engagements. Before we can have our break, what do you think? What do you make of this data from OPM? Those chuckles, they must be aired.
Thank you very much, Mr. Kawude. I'd like to approach it from the point of how do we address the gaps that we have had. Mr. Kawude said at the beginning, we get this data from the Ministry of Water and Environment. So what happens between the time of getting the data and the time of presenting the data? In between, what happens? That they change and we cannot recognize them, but they came from the Ministry of Water and Environment. So, Mr. Kawude, do you do something more with the data when you receive it? How come we cannot recognize it? And what should we do? What processes should we put in place to ensure that it's the same? Who gives it to you, Mr. Kawude? Because I think at the end of the day, we need to zero down on not just the institution, but the provider. Who provides you with that data, which gets to your end, and the bigger providers this side cannot recognize it as their own. And what can you recommend in terms of addressing that discrepancy and those changes? Then secondly, you've mentioned and shown us so many reports. You present them here, 3, 2, you take them to New York, voluntary, yes, national review. What kind of consultations take place for OPM to prepare itself effectively to represent the country? I can imagine if a Ministry of Water and Environment official is in New York in the same room, and OPM from Uganda is in the same room and presents those things, and engineer, you can't recognize what happens. So what kind of consultations take place? And if they're not tight enough, how do we tighten them? So that Engineer Felix does not feel embarrassed seated in a room in New York and it's like, where are these things coming from? But you cannot raise them on the floor in New York, because that's an internal thing. Do you wait to come back, go to the ministry, or you tackle it out in the toilet and you say, you know, those things that you have presented, what is happening? So how do we tighten then? Any recommendations from you would be very, very helpful for us. Thank you.
Let's hear from Moses.
Thank you so much. Just to supplement on Jenny's submission, I realized when in the report you're trying to show where we stand as far as implementation of the SDG commitment is concerned. But I would have loved, we are told in the morning that one of the challenges that we are facing is visibility globally in terms of data as a country. So when you get an opportunity to go to an international platform like in New York, it's an opportunity for us as a country to showcase what we've been able to achieve. So I would have loved to see some kind of trend analysis. But we've been investing in water and watch as a country. Have we made any progress? Have we stagnated? And if we've stagnated, what are the reasons? Where are the gaps? And that we need to focus on going forward. It's an opportunity. And when you are there, of course, I don't expect us to go there and say, as a demand, our access to safe water is 60-something in the rural. Yes, that's the fact. But where we remain that low in access. And we don't want to go there and lament to the rest. I don't think the international community is interested in hearing how badly off we are. But what we are doing to improve the state of access to wash. And then lastly, on the recommendation about financing and funding, I didn't clearly get what the issue could be, because I understand our objectives as clear stated in the NDP as our plan framework. And that's why we pick them and translate them into budgets. Where is the gap? Maybe OPM needs to help Ministry of Water and also Ministry of Finance on how to improve on the strategic objectives we have, and maybe how we can improve on financing, because you probably one of the recommendations. Maybe you can formulate on that, on where the gap is, because I thought they are already clearly going with the NDP, and now that we are formulating NDP before, maybe it's the opportunity to improve. Thank you.
Okay, thank you. Members online, kindly drop your reflections in the chat, and Chris will read for us.
Thank you very much, moderator. I was first the dissenting voices before I could come in. On my side, I'm more in support of the from OPM. Yes, we have owned up. We own the list. So OPM does their work. They do communicate to us ministry. Now the problems start from there, where we give information to them. It depends who receives the communication, who handles, and then who reports back. And you could see a little sort of the inconsistencies even in the presentation that's happened. You present a whole report, and that information comes from us, from the ministry. But who in the ministry, how we are coordinated to give the right information is a bit of a challenge which we need to work on, and I hope these are some of the recommendations that we get from this meeting and also put forward. But in addition to the ministry, we also have the other stakeholders. I mean, it's a celebration of the many questions that I saw raised up, and we are hoping we'll have some recommendations on how we can do the multiple stakeholders. So you could see part of the information that's provided. The first page was from Ministry of Water and Environment. And yes, we own that information. It's not very new to us. It may differ. It may be presenting information of 2021. We have information of 2023 currently. So it's the same range. It can be updated to give the latest version. But largely, by and large, it's what we have provided to you. But then you have another slide which is presented, which now comes from UBOS. So you saw that on some stages saying, access to people with safely managed sanitation is 21%. And the first page you had 41%, which was provided by the Ministry of Water. So as I said, it's not a problem of OPM, but it's just collecting information. So it collects this information from the Ministry of Water, it collects this information from UBOS, it gets this information from the Ministry of Health, and that's what it provides. So part of our strong recommendation is really to get, as you already mentioned earlier, what is the one-stop center, and then how can we improve so that we speak one voice. At the moment, it's common knowledge that we don't speak the same language with our colleagues neighbors. It's not so much that it's about interpretation now. It's not so much, it's not that one of the data is wrong. It's not that the Ministry of Water data is wrong, it's not that the UBOS data is wrong. There's no wrong data, it's not wrong. The difference is in the interpretations, as we say, and what exactly they are reporting. Now, that said, I also expound, we should put a question with a certain for reflection. This is now at the local level, the Uganda level. There's bigger problems when we present this data now to the international level. I am always sort of ashamed of the information I present, for example, on sanitation, say 41. Then my colleague from Kenya presents, he said 21. I said, but I thought I know Kenya is better than us. I said, for us, we are only looking at sewage sanitation, and this is our measure of sanitation. And when you compare it, when you present figures and say that access to safe water in Uganda is 79%, yes, and then when you get from Malawi, you present 50%. What is he talking about? Well, he is talking about safely managed water on premises. What are we talking about? We are talking about access being to 1 kilometer. So when you say I'm saying 1 kilometer access, now everybody laughs and say 1 kilometer, how can that be access? So there is a need to also map this on the international scenes that that's why the JPs I think probably helping us, that we are all speaking the same language. If you say access, what are we talking about? Are we talking about the 1 kilometer? Are we talking about on premises? So that everybody reports the same figure, but at the moment there is some inconsistency. We did want to drop away from our 1 kilometer, 200-meter assessment, because it's what we had been measured in the last 20 years. So we want to see our progress also on that. We want also progress to bring in the new indicators, but which are harmonized across the country. Thank you for the presentation.
Mr. Founder, thank you for the presentation. Mine is a question on how you work well with the district local governments. Because when you go down there, in your presentation first you said part of creating an enabling environment, you try to send their reports and monitor. But our experience is when you go there to the district local governments, the understanding of these SDGs, especially 6, is far much different. That's why in the presentation we had yesterday, we said that it's like an alien. They will know, okay, not leaving anyone behind, we have to provide safely. But when it comes to the actual measurement, actual tracking, it's totally different. So how do you work well with these district local governments? How do you just give them the reports and then you leave it at that, or you go ahead and break it down on how we should measure SDG 6, how we should track and all that? Thank you.
Let me allow Ivan, I will conclude here. Sorry. You are the mother, so you melod, and you can let your son take your time.
Thank you, Lydia. Thank you very much, the presenter, for that insightful presentation. Mine is just to speak to a few things from the presentation. I want us to contextualize the SDGs in this perspective, that these are indicators with parameters that are comparable on a global stage for all of us to see performance. I want to reiterate what my boss has said, and in effect that we need to look at this in terms of it is not conflicting data, but what is the interpretation of the data clearly reported. This VNR, the Voluntary National Review Report, is one whereby we are painting a picture in terms of SDG performance as Uganda over these years, and based on those international parameters. So what happens in the country context? OPM established the SDG Secretariat, which is supposed to guide and coordinate. Its role is to really collect information on how the performance of SDGs is working. But underneath there, the setup is in such a way that we have technical working groups. And in this perspective, the data technical working group is the UBOS, is championed by UBOS. What does UBOS do? UBOS holds routine household surveys from which they believe if they look at the parameters for these SDGs, they can incorporate them in their surveys, and this is the data they report. So you will find that an indicator reported on by UBOS and the same indicator reported on by the ministry may have varying performance levels, but why? What parameters are we taking and what are we taking? Yesterday we were having a discussion and we're looking at SDG 6.1. It has, I think, around 4 to 5 indicators. But when you look at the ministry monitoring framework, we pick like 2 indicators from that particular sustainable goal. And what happens to the other 2? So there is a bit of some work we need to do, but we need to understand where we're coming from and where we're going. And at this point is where I want to refer to what Mr. is saying, that we are investing money and money in water, but why do the indicators portray something different? So we need to understand the dynamics of where in Kenya sanitation, they will be looking at a particular parameter which is globally determined. And here in sanitation, we are saying, okay, let's look at where we're putting the money. We will get to where international levels want us to get to. But at the moment, let's track what we are doing. And that's how the indicators to some extent are differing. But at the end of the day, the question within should be, how do we struggle to meet the standard global parameters in whatever we are doing so that we speak the same language? If we're in an international conference in New York, how do we report and comfortably say that we have done enough to be at this level of performance? Thank you.
Okay, thank you, Ivan. Martha will give us the last comment here, and Mr. Kamunde will respond and we'll break for tea. Can I like Lydia to say something?
Sorry. Now, it's a very interesting exchange, and I really think that we're very close to find new solutions. What your engineer Felix, right? What you just said about UBOS and the ministry, we have different results. But we need to remember that you are not measuring the same things. The ministry, if I'm not mistaken, you're looking at availability of service. You provide services and you say, for example, a hand pump, it's covering so many people. UBOS, when they're going to see the users, the households, they're going to say, what is your main source of infrastructure that you're using? Using not what should be usable. And so it's 2 different things that are very complementary. And it is very, very important to work together, looking at the 2 sources of data to see where, as you said, why do we have so much difference? I'll give you one example that I worked in Burkina Faso with the Ministry of Water. When the census came out, they said the results from the statistics office was much better, was better than what the ministry was saying. I said, no, that's not possible. We cannot have that level of access. We looked at it, looked at only the capital city, and they said, okay, according to the statistics office, according to GLAAS, they had so many people using either a private connection, a direct connection in their house or in their plot, and so many people using a public tap. We discussed how many direct connections you have in Ouagadougou and how many public taps do you have in Ouagadougou, and compared to the population that was declared by the statistics office. Discrepancies. The very important thing is that you work together, and as you said, it's not like the ministry's data is bad or the UBOS data is bad. You need to work together on looking at the reasons for discrepancies and find solutions and maybe improve. What the ministry decided to do and the utility decided to do, they changed their ratio of number of people reached by stand posts after looking at the data from the census. Thank you.
Thank you, everyone, for your comments. Thank you, Mr. Kaunde, for the presentation. I was looking at Mr. Kaunde's presentation and I was saying, wow, Uganda is about to be reported among the countries that are on track to achieve the water SDG. And that's gives me mixed feelings because we know actually what the situation is on ground, but there are places where we shall not be, and it will be the SDG Secretariat that is in that space. And that makes me think, how do we support the Secretariat better? Because it is the structure that was put in place, fast track, but also ensure SDGs are running well in the country. I don't know how much support sectors can give, or to make it function so that it speaks to our realities, our challenges, and it is able to represent us very well. Maybe that's part of the engagement we need to do. I don't know, Mr. Kaunde will highlight maybe beyond the data collection season and all that. What other engagements can we do during this other off-peak season to make sure we have common understanding, to make sure we are speaking the same, so that if a figure comes in and we have that common way of understanding what it is that we're talking about, then they're able to even interrogate it and say, is this true? Can we check again? Can we, So I'm looking at it from a point of system strengthening, even for those supported entities that are to the sectors, like UBOS is, like OPM is, so that in those spaces where we shall not have a chance to speak on our own sectors, we are still represented in the best way that we can with a realistic picture.
Well, I think all of this makes this workshop very timely and relevant, because we are really speaking directly to the objectives of the workshop. And I think that OPM was a good addition to the meetings. So Mr. Kaunde will take some 2-3 minutes to bring all of this together, and then we'll have our predictive because it's already signed.
Thank you. I thank you for your comments. Most of the comments now we are organized our data. You should have an agreement with this secretariat. This is secretariat has a number of staff about technical staff there are 4, 5, and the support staff about 3. So it is that small. So most of the work they rely on the committees are not that functional sometimes, so they rely on the documents because they have contact persons in the years. So most times you say, right now, yes, so most times you know if it is my first time, if it is so I think we have to now analyze and see how we see that we harmonize that. That's a very key thing. And we should take it forward. Let us see how we will support this. And though I'm not following the order, I'm looking also at that as soon as inquiring about the financing. Financing is clear. We realize that most of our intervention, the wash, most of them are funded. So you are looking at the points and is it sustainable given the economic for institutions globally? So how do we support the ministry to do the work? Most projects, most of them are not funded. So it is for us to see sustainable. Let us see how we start financing our own. The same applies to corporate then sometimes change as an output. So in about 10 years time, in about 4 years, we have moved about 3 years now. We're seeing how what if we do us, how we do us, how we do sustainably. So the same applies to all sectors and is very key. The other thing I looked at, I think it was made on that how we work together, we can organize a meeting because the sector is key. Then when the delegation is traveling, each and every SDG call normally has a representative, the key mother ministry. And for all the conferences that are needed, should have what they have there's a meeting the delegation is a bigger delegation. So, but I think before we go, the key thing for me I've noted the issue of data and how do we work together. So I think we should sit together, OPM, the SDG Secretariat Administrative Board, what our SDG. Then after that, we should cascade into other SDG goals. Then someone was asking about how work with the governments. From my experience at OPM, I realized that most of the work is done at the center. So local governments have very few, they have very little input, maybe repairs and whatnot. But if it is going to be a project, you find the contractors program has been contracted by the ministry. So what we're trying to do with the SDGs that the local governments, let them appreciate that how we now implement, how do you advocate, how do you educate. SDGs, the real things we do, but just we need to understand, to implement things consciously. I think that this is SDG. If I have it as SDG, if I report it as SDG. If I report it in the PDF, if I report it as MP3, so someone should be able to report consciously and knowing that I'm putting on maybe SDG, but local governments, all of them. When we're calling consultative engagements, we normally do select like local governments, we don't go to all. I'll say it's regional, which is so it is selective. It is not all. We don't consult all of them. But with MDs, each and every technical group has got a ministry, because our ministries are around 15. So they are represented when we are doing those certificates. So I think the key thing is how we work together. The SDG intermediate and the MDAs. And in this case, we're saying water. We are much interested in water because I know you can deal with it, and you can't deal with without water. That one is, at least I've experienced, and I know it, that without water, you can't get sleep. So we are going to get that point. Some people can spend the day, but most people can't sleep from not being and let's talk a bit balance. But the kid, if you have a kid at home, and the kid is feeling heat, you really do want to sleep balance. So water is very key. It's the key to our compass. So so let us see how we balance this. Let's see how we balance this. So I think that the making take home is how we open to the involved stage. The same as we have been involved with you on the data collection. How that we keep quiet. I think whatever next year, so we should be if you have partners with that kind of problem, they still they can really keep support. Because I said, money is in but we give women, I think because of that problem. Women, the minorities that's also. But they work with everyone. So if you want any, if you can support them in any way, need information plan, we can arrange and see how we move forward. What is key for all of us. We should not leave anyone behind. Thank you.
Very much. Working together so that we are all speaking the same language. At the end of the day, we are all serving the same Ugandans, so we have to find a way of converging all our perceptions, interventions, and workings. I think that we've earned our break, T, and we can now break off. It's 5 minutes to 11. We're going to have to cut our break short. Let's use only 20 minutes, yeah, so that we redeem time. So let's be back at 11:15, and I'll be very happy to come and call you back when the time comes. Please enjoy your break, and let's make it fast so that we redeem time. Thank you all for your active participation, and thank you, Mr. Kaunde, for the insights.
Yes. No. Yes. Oh, we are having.
Oh, we had a lot. We work together. They were out. We
That's the exception.
Oh, yeah.
Many hours a day. This is the thing, the JMP is. The criteria. And for the number of hours for the service, it's, I think that's all criteria. Yeah, there would be some. What you say, it's 1 hour a day. Yeah, of course. That's right. Source household service or the same. I think you have 4 from the same that can be compliant. It was some standard question that you could ask the past. The old conservation. Yes, we also recognize it was very similar. All the data was from the sector and some was usage and things like see if there is a significant on. I think it does that here. I think all of the they didn't no. Just one of so this is, and I really like where he was just very exciting. Sorry for that. It's like anything nice to meet you. You think we're from yes, for the DHS or the DH. Thank you very much. For this is for when DHS came. Oh, sorry. When DHS came out, the result on water quality about general water quality, the percentage we had to make a difference between the different types of sources. So it was without yes, I'm getting 60% of people don't use the main resource they're using the so but that is no that's project for the we make. We actually not exceed like big 20% and water is for if you go down, Anyway, that's. One question, which so. Yes. The fact that we're saying.
So according to my watch, it's 1:15, and we should be back. Today, our DJ did give us a music interlude. We've had Chime as far as entertainment is concerned, but it's all well. Let's be back. Please pick your last banana, pick your last cake, and pour in your last cup of tea, and return to the table because Martin is ready for us. Martin is ready. I welcome you back from the break.
let's get into our second last session. And Martin is going to lead us. We're going to consider the sanitation indicators. And we're going to consider one by one. And the purpose is to try and come to an agreement. What each of these indicators mean? Is this what they should mean? Is the way they are framed here the cause of some differences in perception and perspective, and ultimately differences in data collected? This is part of the harmonization journey, that we should all agree on the meaning of these indicators and therefore what we track. We want to see the situation where whether somebody is representing us in New York or in Geneva or in Kamwenge, we are all speaking the same language. Because we are talking about one Uganda in a certain politician's voice. Please, let's be back, and Martin will take us through the next session. Friends who are still grabbing your coffee, you can bring it over and have a working tea. Martin, are you set?
Yes, good morning. Good morning.
Good morning. Yes.
My name is Martin Akonya. Like our moderator said, I'm going to walk us through the measurement framework for SDG 6.2. A lot has been said of how we have discrepancy in the data sets that we have. So what I'm going to do in this session is just to walk us through as we discuss in plenary and we agree on a number of indicators that we have to measure. And I believe after that, it will take us a long way in addressing the variances we have in our data sets. So can we move on, boss? That's the presentation outline. We have the question on why SDG 6.2. Then we are going to look at how is SDG 6.2 measured. What are the statistics on SDG 6.2? How is the data obtained? And finally, we'll look at the challenges that we face as we work towards measuring these indicators. A lot has been said about SDGs. We've had definitions of what they are, how a global agenda to see that we have sustainable development across the world, and the number of goals that we have, the targets, the indicators have been mentioned, and now our focus is on SDG 6.2, whose goal is to have access to adequate and equitable sanitation and hygiene for all, and end open defecation, paying special attention to the needs of women, girls, and those in vulnerable situations. I believe this is known to all of us. Let's move on, colleague. How is this SDG 6.2 measured? We are saying that we measure this using indicators. And which indicators are these that we measure when it comes to SDG 6.2? One, we are looking at lateral coverage, which is access to any form of sanitation. And I believe as we move on with the presentation, we'll be able to dive into that and we dissect that so that we come up with a common position. The other one is open defecation. We have basic sanitation, safely managed, then hand washing and households and schools. So basically that's what we look at when it comes to SDG 6.2. How is SDG 6.2 measured? I'm beginning with lateral coverage as our first indicator. We are defining this as existence of any form of sanitation facility. Colleagues, like I said, I want us to look at each of the indicators, we dissect it, and then move on to the next one. So are we all in agreement with that definition of what lateral coverage is? Is it okay? So, colleagues who are up, who are in, and we have a mic so that we keep discussing and then.
Yeah, thank you. My comment is on the use of two terminologies, latrine and sanitation. So I think we have to be consistent. If we say latrine coverage, then you find us limited for any form of latrine facility. Otherwise, sanitation is a bit wide.
Colleagues, are we okay with that submission? Okay. So colleagues who are out, please help us with that so that at the end of the day, we have that sorted. Yes.
Yeah, okay, with the SDGs, there is the global goal and indicators. And actually, the indicator is for sanitation is not coverage, it's the use of safely managed or the different other level of services. It's really the use, not the availability of the infrastructures. It's slightly different. It can be for the MDGs. We were very much more looking at infrastructures, but also the JMP was looking at the use of the different infrastructures that were considered improved. Now we're looking at safely managed, but the use of safely managed services or infrastructures. It's slightly different. The way, if we look at coverage, it's going to be the availability of appropriate infrastructures, but maybe the use is different than the availability of the infrastructures. That's a slight difference between the SDG target and what you're suggesting. That's a good proxy. And the example I was giving for Burkina Faso is to look at the two to learn why do we have that difference.
Okay, if I can get you well, you're talking to the aspect of the existence of the facility and its usability, right?
It's the use, not the usability. If there was a big sorry, in India, there was a lot of latrines that were built, beautiful latrines. So beautiful that people decided to use the building of the latrine. Instead of using it for a latrine, they had put their goat or sheep in there because they were protected. So the use of the latrine, there was a latrine, perfect latrine available, but they decided not to use it because it was better built than their house. So these are important things to look at. It's the use, but the availability is important. If you don't have the appropriate latrine available, of course, you're not going to be able to use it. So it's two different things that are very important to look at. And UBOS is looking at the use of the different categories of latrines. You are looking at the provision of latrines to make sure that people can use it. Now, if they decide not to use it, that's another problem.
Then the other question now is how do we know that household A or B is utilizing the facility? Because if I walk into a household and I found there a toilet, how am I able to tell that they are utilizing it or not?
And to add on what TPS said, I think the latrine coverage, I'm not sure how shared toilets are reflected, because there may be a household that is using the latrine of a neighbor or relative just living next door, but doesn't have their own toilet facility. I think just also something to take into this discussion, which households without latrine may still be using one and not practicing open defecation, which seems to be at the moment the default assumption that whoever doesn't have a latrine is practicing open defecation. Another reflection, and I'm not sure whether you're getting there, how it's measured. I think if you're counting latrines, I think it's also a question, where is this data coming from? I understand it's from the village health teams at the moment, but there are many. And how can you ensure the quality of data that comes from millions of households and aggregating them upwards? Do you get reliable data or not that reliable data? Thank you.
Let's first hear from Stephen.
Yeah, my hand was up because I thought a lateral coverage per se should not be coming under how we measure SDG 6.2 because it's not there. It's because we've seen latrines which are better not built. So it doesn't really help us. Which are better not built. Someone actually brings the open defecation spot into the home because you've built an unimproved thing which is shallow, which is attracting flies and so on. Maybe it's better you go down in the valley and defecate. So latrine coverage per se is not under the SDG 6.2. So it is something which can help us. It's good to measure it. Yes, because it helps us even to plan. If you know that you have 75% coverage, for example, in an area, then it is indicative of how the households are thinking. It means 75% of the households appreciate latrines. Now, it will help you to plan how to get them, say, to improve, to basic. And then you know that maybe what you need to do in your strategy is like to look at how to upgrade the already existing animal latrines. But under SDG 6.2, it should not be there as an indicator. Thank you. Any colleagues, any other submissions?
Sorry. Just a quick one. I have an emergency in me. Remind us of the problem we had during the COVID time when the president wanted to shut down some of the arcades and malls. So some malls like a Acacia Mall and good, those can remain working. But some malls which are small down, you couldn't find. So he said arcades can be closed, malls can be open. People started fighting, what is a mall, what's an arcade? Okay, I'll just say the name and put again, I agree with you, there are very many latrines which are in that poor state. But there are also, I think, more, I won't say latrines which are in or where we tell the difference which one is a bad latrine, which is a good latrine, may be quite challenging. It's quite a big issue because 80–90% of people are using some photo latrine. There's a hole. So there are good holes, there are bad holes. Now, where we draw the line is where we need to discuss. So we see the one that really is out there, they are the broken countries where we have a problem with it.
My point is where yeah, I think I also want to contend with Doctor on the issue of us having to capture all the facilities that we have. I believe that from that is where we cascade down and then go into having the different service levels. After we establish how many facilities do we have, let's say in GG. Then from there we tease out how many are sharing, how many are not sharing, how many are increasing. But it's good for us to have to know how many are there. So what is our solution on this? Steven is over.
I just had one comment on Brother Rao's about shared facilities. And it has to be clear what the shared facility is, because discussing with Martin before, when it comes to the same Kampala, a landlord builds a block of toilets for his tenants. Each tenant has a unit, and it seems like they're using one facility, but each tenant has their own unit on that facility. Now, how would that be captured? Is it a shared facility or is it an individual facility?
Not shared.
Not shared. I think that also has to come out clear with the person who is.
Thank you. Sympathizing with my brother Martin, what indicated, because we've been trying to maintain it, first of all, for political reasons, because sometimes if you say basic is 19 or 20, the politicians may ask, what are you doing? Sometimes we maintain certain indicators for political reasons. However, maybe in other parts, maybe when we go to open unification, would I be correct if I say, if I attach lateral coverage population, for example, if I go to your household, you have a lateral, and okay, if you go to a village which has 10 households, in that village there are 5 houses without toilets. There are 10 houses, 5 without toilets, 5 with toilets. And then I find that of the 5 houses, 70% of this population is in these 5 houses. Then the other 5 is in 10 houses without toilets. So then be ready to say that 30% of this village is being ready. Because we have thought that would somehow help us to come up with how we calculate identification. Just if we don't.
Yes, I was just thinking about when we say shared toilet in this case, and one that is not shared. I'm trying to operationalize this in context. I was just telling my colleague here that somehow, somewhere, my household has a toilet, but I have a younger brother with his handsome who does not have a toilet. And what happens, year in, year out, it is mine that is used. And there is no restriction in terms of access. Whenever they want to go there, they will actually do what? Access. So I want to understand whether shared toilet facility means unsafe or it is actually safe. Because then I've given you my scenario, and that's why I'm saying we need to operationalize some of these concepts. I have a small household, I have a toilet, my young brother has his hand, it's considered a household with his wife, but they use my toilet facility. When you assess them, they will say we don't have our own, but they have unlimited access to mine. If you get, they can go there anytime they want, even in the night, and so they are able to access that weekend.
Colleagues, I think we're moving very fast, but but just imagine that you got a misunderstanding with your brother and you stop him from utilizing the facility. What happens?
I think we need to change reported percentage of population having access to any form of sanitation and actually call it to any form of latrine.
Well, we are changing latrine coverage to sanitation coverage.
We are changing the tree coverage to sanitation.
Yes. Yes. So we are saying defined as existence of any form of sanitation facility. So it is all through sanitation. I think we need to be clear here. What are the different sanitation options that we have in the communities? So those are the ones that we needed to talk about. First of all, we have people with septic tanks. We have people that have JMP materials, and we have those that simply have a pit. But all these contribute to safely managing sanitation. So if we are to actually look at the broader one where we are looking at sanitation equipment, all these are supposed to be considered for us to look at safely managing sanitation. All of those are provided 8 options. Okay? So as we go along, then we will have that more maybe Martin should go ahead and finish because we are jumping to different levels and yeah. So maybe let me just say everything and then all right. Can I now move on to how we compute? We having A over B times 100, where A denotes total household population having access to any form of sanitation, and then B denotes total household population of the district, stroke urban town council. We're looking at the towns, RGCs, and some counties. So that's what we have under numerator and denominator. Are we comfortable with that? Okay, so this is moving. Next, we are having basic sanitation. We are saying that this is the use of improved sanitation facilities that are not shared with other households. And what is an improved sanitation facility? Is one that hygienically separates human excreta from human contact. When we move to the computation, we're having A over B times 100%. A denoting the number of people in households using improved sanitation facility, not shared with other households, and B, total number of total household population of district or urban councils from our council, other districts and counties. That's fine. So let's go to that's what students are listed to present.
Yeah, yes.
Yeah, you keep noting it. Okay. Let's move on. We are looking at safely managed, being referred to as the use of improved sanitation facilities, not shared, where the excreta is safely disposed of in situ or transported and treated off-site. And we are reporting it as the percentage of the population using safely managed sanitation services. And how do we compute this? We have a numerator and denominator. A denoting total household population disposing safely in situ. Then we have B denoting total household population reported to have emptied and transported excreta by developers, successful emptiers. Then C is total household population using sanitation facilities connected to the sewer system. And finally, we have D, which is the denominator, being referred to as the total household population of the district or urban council, doesn't matter. So that's how we compute our safely managed sanitation. Let's move. For open defecation, we are looking at it as disposal of human feces in fields, forests, bushes, open water bodies, beaches, and other open spaces. How do we report this? We are reporting it as a percentage of the population practicing open defecation. How we arrive at the figures of computation.
We have A, defined as the total number of people in the households practicing open education. Then B, total population household in the district or urban council. And what is the assumption we're making here? The assumption is all households without sanitation facilities are practicing verification. So that's the hypothesis that we make here. Let's continue. When it comes to hand washing with soap at household level, we are saying hand washing is the act of cleaning hands for the purpose of removing soil, dirt, and microorganisms. And we qualify it by having clean water and soap. And how we report this? We report that the percentage of the population using hand washing facilities with soap and water at home. The computation on the other side, we have in A over B, where A stands for total number of people in the households that have functional hand washing facilities with soap and water. And then B, total household population in the district or urban council. And the assumption is, the condition is that at the time of spot check, or spot survey, functional hand washing facilities in the household must have clean water and soap. Right? So let's continue. And we have hand washing in schools. We're saying we measure this as we report this as percentage of pupils enrolled in schools with basic hand washing facilities, and the computation is presented over B times 100%. A denoting total number of pupils accessing functional washing facilities with soap and water, and then B, total number of pupils enrolled in schools that have functional hand washing facilities with soap and water at the time of spot check. These are the statistics that we have as of FY 2020-2023 the national coverage, verification of basic sanitation safety for urban and rural. This is what is in our performance report. Let's continue. What are the data sources? We, at the end of every financial year, we send evaluation data collection forms to the district local governments through the DHO's office, and then these forms cascade down to the villages. And that's how we collect our data, which is relayed back through the same structures up to ministry level, and then we compute the data in Excel. We work as the two ministries, Ministry of Water and Environment, and Ministry of Health, and then we have to present these figures. Then we are also talking about we get a bit of statistics. How we get the population figures? We rely on the population figures with us. We have average household sizes for different districts. So we use that to come up with the population figures that we use for computing the statistics that we presented. The challenges that we face are the same as Kate presented yesterday. They are around the aspects of the MIS being paper-based. They are being budgeted for data collection, and then the measurement framework being made into number of students. So colleagues are able to stop there and then we can push it. So we can go back and then we start giving our input into this, then we should be able to conclude. I think we are digesting that. I'm going to colleagues, basic sanitation, are we?
I have one comment here, just for reflection, as improved sanitation facility versus unimproved facility can sometimes be a discussion point, different opinions. Just as an example, what we're doing in Ethiopia right now is trying to prepare a short guidance document by the Ministry of Health, defining what the ideal status is of an improved latrine, but then also to define what is kind of the minimum threshold that it should be counted as improved. that whoever is looking at the latrine using this guidance, you will come up with the same classification. Just as an idea, and be aware there's an ideal status, and there is kind of the minimum threshold that you could still accept. What do you do? If just one small thing is not good, will you still count it? Thank you. We look at the same units of traces. If the numerator is where does the denominator go to household, then we generate. Because the denominator here is saying town council, businesses, counties. We can get there if we say there are 12 people in my household, but the people using it, then how many households in this village? How many households in this parish? How many households? But when we say town council as a denominator, and the numerator is household, we don't know these different units of needs.
Okay, thank you, John. The numerator and the denominator here, we have the population figures. The population is up. So if we say, like, let's say Ginger has 50 households, the population growth rates for history. So we look at if there are 50 households, we multiply by, let's say, multiply factor of 6, then we have 300 people having access to service. Then we get the denominator of Ginger district. So we can believe it. Okay, I just wanted to supplement. I just wanted to supplement what John is saying. The issue of denominators and numerators in the sources of data are very key. If we are talking about population, let us. And in doing so, for us, we look at the numbers of people, access to improved toilet facility. And that is it. Now, that is information we have from people. But then the denominator in this case, we don't have control over, and this is where we need to liaise with Google to get the populations in these areas. That helps us to have that population. Then we always capture the number of people and then do that, which I think is something that we always do. But the level of engagement of users in that case needs to be. Yes, I think that is what I wanted to say.
Yes, I wanted just to clarify on one thing, that when you see the town council, RDC, sub-counties, shouldn't create confusion. It's just speaking to the fact that we are picking both urban data or data. Yeah. Yeah.
Yeah, thank you so much. When the gentleman from OPM was giving the presentation, somehow he mentioned applicable indicators, and those indicators where they have data points. And if you look at that too, you will see a very big variance. So the question would be, what would be the problem? Meaning you have so many indicators, but you just have a few as far as the problems are concerned. And this is what we are trying to talk about. I want to comment on that the gentleman, saying that if I have my salvation facility, in this case there are 3, but I don't have, my neighbor doesn't have his, but he has an internet access. When you're going to do your survey to find out how many households, how many people have their twins, does that person have? Yeah, does not have. And I wanted to picture a scenario here. If you're trying to establish orphans in a given community, you have to find who an orphan is, right? But you have a neighbor, whatever he wants, whether feeds with medical care, whether what he gets, whatever you can think of, is going to this goes from the father, from the mother, from the parents. Would you consider that person as an orphan or not? So in terms of what you define, any indicator you measurable is about the definition of that indicator. We know a lot of exclusion and inclusion. So if you have defined and offered a bigger person who doesn't have a mother, regardless of the support you get, you remain an orphan. So whether you have unlimited access, the facility out there, as far as it is not yours, because it is attached to the household. Unless you're looking at an institution level where everyone can go and access. But if you're looking at the household level, if you don't have yours, you can share. You don't have completely. So I hope maybe I needed to make that kind of contribution and also which ties into what you were talking about, the unit of measurement. The unit of measurement, ladies and gentlemen, is very, very fundamental. And it's what you base on as far as indicators are concerned. So if the unit of measurement is free, you cannot talk of growth. You can talk of disaggregation, for example, and also for individuals, you can talk of disaggregation by the different admin units, by the different regions, but you cannot have a numerator talking of households and the denominator is talking of a different thing. That cannot happen and you will not find it anywhere. Thank you.
It was very clear.
Thank you so much, Mr. Singh, for your comments. I think they are very valid comments. But members, I think we need to discuss from a point of proposition. When you have an issue, when you finish stating it, kindly propose what you want us to do. Because we are going to spend the whole day here pointing out the issues, and we shall not reach a consensus. And we don't have the whole weekend. We have just to discuss the sanitation part, then we also do the water part, and time is fast running. So when you have pointed out your issues, kindly point us to a solution so that we have a way forward going on. Thank you.
One of the key objectives of this session is about harmonization. And believe me, in this room, with the limited time we have at our disposal, I don't think we can do much. But we have appreciated the challenges we have at hand. So my proposal is that probably if we came up with a task team, representative of all the key stakeholders here, and we agree on how to move forward. If it's about to come up with some kind of roadmap, and probably meet for a few days, the task team, look at the indicators we are tracking, the gaps and all that, I think that would be very, very helpful. But by the end of today, as far as harmonization is concerned, we are going to identify all those key gaps, and we will achieve much at the end of the day.
Somebody is going to it.
Yeah, for me, what concerns me quite a bit is the other definitions I think we can understand. What concerns me most is the definition of improved. Because improved is defined as, like an improved facility is defined as a facility that separates fecal matter from human contact. But the people who determine whether it is improved or not, I think the VHT members and the health assistants. But Martha, what
what would constitute improved? Is it washable flow, like some quotas want to say that as long as you have a washable flow, that is a sanitation facility? Is it a sanitation facility with a superstructure? I've seen very many where I have worked, especially in the region where we are sitting now, where there is no superstructure in the trees there. Is it, does a door constitute what should be considered improved? Because a door eliminates some people from using the latrine, especially in the daytime. So what is improved? And we're leaving this to the PhDs. So what is an improved facility? That is one thing that I was thinking about. Then shared. I was also thinking about shared. If you have ever shared a latrine in your lifespan somewhere, maybe you just started working, you are renting in Kasiko somewhere, and there's a stance for two different independent households. I don't know whether you've gone through that experience. That actually you basically have one of three. Because you are going to quarrel over cleaning it, you are going to quarrel over tightening it, you are going to quarrel over who keeps the key and how the key is used. So basically a shared language, even if you are lucky that your brother doesn't quarrel with you, but the day you quarrel, you just knock the latrine and walk away. So basically it doesn't own a latrine. Thank you. Yeah, I think issues around latrine indeed. But what I also wanted to observe is sewerage in this case. I don't know whether that could be covered at a different point for it was mentioned. But okay, thank you so much. I agree with the idea that we should constitute a committee, a small committee of experts, to sit and break down these issues, and then report back to the committee later. We would complete the issues of what defines an improved toilet, what defines shared in a meeting like this. Let's constitute a committee, and then we have all those definitions clearly spelled out. Because right now, I think I'm not in those definitions, but I know you have those somewhere. They have been discussed before. But pull them back and put them somewhere in the document, and we say that as a country, this is what we've agreed upon as what constitutes an improved toilet. Just saying that it separates feces from human product is not sufficient. The issues of privacy, those are limitations to the use of sanitation. If it has no door, the chances are that you will not even defecate population eventually. or you are likely to soil. You may not even. So these are details that are in there. So the idea of having a committee is I agree with it, and then we come up with all those definitions of all these individuals. Thank you. I had to give us the last one, and then we. Thank you. And I'm not disagreeing with neighbors, but I'm taking and requesting people who communicate directly with agencies like UNICEF and WHO who come up with these standards. But we should also be a bit more clear. I remember when you go on the internet and you download a picture of an improved toilet, one by WHO, they showed one which had the cemented floor, but without any walls. We are saying it is improved. Because according to them, that picture is there. If I get it, I will saturate it. According to them, as long as the floor was washable, meaning that it hygienically separates human excreta from human product, then it is improved. But the walls, the superstructure is not quality. So those are ironies we have, and also because of because one would argue that every this element is more of a social issue. It seems not the hygienic issue. So yeah, thank you.
Are we about in this debate?
Members, please allow me to say this, that the JMP standard is a standard that is global. And we have a duty as countrymen, we have a duty to localize that standard to things that work for us. And that's why we are here. We need to pick out those things that we want to count. If we speak improvement, for example, the JMP doesn't really recognize the traditional people training. But that's the predominant technology we have here. What is it that we can do to that people training to make it qualify to get into the basic? What if we think about if it's a traditional people training that is fitted with the central? Do we want to count the country? So that's the kind of conversation we want to have in this room. There are those key aspects of a sanitation facility that make it safe, that make the interaction between the user and the waste safe. We know them, we want them, but how do we go around them to make them fit into our context? So at the end of this, we may not have a final, and that gives us work for that small committee that we're talking about. But let us keep speaking to those things that we think we need to do in our context. As Uganda, the JMP standard is good. It points us to a desired, perhaps, situation, but we must contextualize it. We must localize it. We must put it in the things that work for us, holding some facts constant. I thought I would say that. Thank you.
It's really good, Martin, what you just said. Contextualize is key. In the SDGs, there are some targets, clear targets about what at global level it's going to be looking at. Now, it says also each country will have to adapt to its own context what the country wants. And it's important, as you're saying, that you decide strategically, politically, what is the level of service that you want to attain. In Mali, they said pit latrine with a slab, the hole in the slab should be covered. That's their decision. Now, it is important that between the definition that is coming from the Mine Ministry, from the Ministry of Water and Sanitation, that there is a clear definition of what you're looking for, that household surveys will follow what you're looking for, but at the same time, you need to be able to report to the global level with an additional, a different definition, so you can explain what is, based on the national policy, this is where we are, and based on the international level requirements, this is where we are. And there will be a better understanding between the two if you can do that. And I was saying on first day or second day that it is very, very important that at national level, the definitions are harmonized between the different institutions. It's key. Then you need to align with the regional level, and the global level. So you can explain to decision makers, well, JMP is saying that, it's the definition at global level, but for us, our policy is this, and this is where we are. I think it's really helpful to do that. It makes it a bit more complete.
indeed just some examples related and more span and information. That's on the shared sanitation we're going to talk about. This is a lower case of adventure against it, but the same context that we are presenting is that there are some two areas with some bit like things we think are acceptable, and the other should be on the quality that are defined. Similarly, on this shared sanitation, it's true the examples Stephen gave are also true, but there are also other extreme examples. We published a small paper, it's an open source paper, please everyone who can find it on the net. It's called The Case of Shared Sanitation in Informal Settlements, a dialogue on science, policy, and practice, arising from the discussions of the last UNC meeting in North Carolina. Yes, and we are trying to put these cases to JMP to consider them as safe. And in there, you find some pictures of very good sanitation facilities, for examples in Bangladesh, in Nairobi, very excellent, well done. And it's also many people, like in the former settlements, we would want them to have their toilets, but it's not possible because of the nature of the land. If we had said that, then 60% of the urban people will never be considered safe. So what can we do in that context where it is practically impossible to give each household? So we say, let us put a facility, it is shared, but these are the parameters 1, 2, 3, to make it relatable. If it's not, and it's plausible by someone who gets angry, then we remove that. But if there's one which is truly public, every household has a key, everyone has lighting, it has everything, then that can cross the line to it. So it's about to do at the national level as well. Thank you. Just really getting back to improved and unimproved picture trees. I think indeed the global definition put out in a document called 4 questions for both sanitation and hygiene for household surveys specifies all that is needed for a picture tree to be considered to be improved is to be a slab or a platform or a slab that is durable and easy to clean. And that's it. Now, at the national level, the regulation would be as long as the term improved sanitation facility is used to stick as close to that definition, because otherwise we'll have the same term with different meanings, which leads again to confusion. I think if a different service or a different technology level will be tracked, I think it would be nice to give it just a slightly different name, that it's clear we are not tracking improved sanitation facilities as per the joint monitoring program definition, but a slightly different, maybe safe sanitation as per the definition of the Ministry of Health or something like that. And as I mentioned before, I think you always have the challenge between the design criteria and what you accept when doing a survey, when doing an inspection of the tree. And what is where you would like to be, and to what level would it just be still acceptable to count as an improved facility. And if you have that specified, and that's shared with you, boss, with the village health teams, with other people working on rural sanitation, I think it's likely that the data will get more and more aligned, that you have similar data, everyone, because you're really using the same definition.
We have here some examples of facilities. We have the flash toilets, stroke or flash, connected to a septic tank or a sewer. We have the VIP latrines. We have pit latrines with a slab and then the composting toilets. All those are improved kind of facilities that we have. But like colleagues have said, when we constitute a team that will be able to digest all this and then come up with a position that will communicate with the general country. I don't know where the UBOS team is. UBOS, they're out.
Yeah. Because I feel we should be having input in that conversation, so that at the end of the day we have a common understanding of these indicators.
Thank you, Martin. Thank you, team. When it comes to measuring these indicators, the center is always shared some of the templates to use to report. Martin did mention that. But for me to summarize data and report as a district, there should be a tool that I'm using to collect the data at household. And when we reach the school, we should also speak to that. The data collection tool when I'm in the household. In this country, we have a VHT register, which a VHT can use. It's not a full aligned with this we're talking about. And this data is being reported only annually, like at once. So all through the year, as districts, we are fidgeting, trying to use, develop our own inspection checklist because we need a health assistant to report to you something. So you speak to me so that I read this meeting with have we done something to have a tool that fits, that collects the data at household level, that speaks to the summary tool? Okay?
I think that is something that we need to think through and see how we can do that. So what I know is that we have one that aggregates data from the villages and then it feeds into the AHP collection form, which one is shared and then we will finally share. So based on the data that comes from the different villages, we come up with the sub-county figures which feed into the district figures. But I think we will have to work around and come up with a tool that helps us collect data at that level, at household level. Colleagues, I want to bring this to an end and then hand over to the moderator. Are we still continuing? We are happy that we constituted.
All around, I thought that we are going slide by slide. If you will look the slide of authentication. Yeah, the time is there, but my contribution maybe I may not get a chance of being on that team to do this. But where I come from, I see when you consider the hotspots for authentication, it's not actually in the households. But my contribution is majorly find authentication in public places, in rural areas where these social happenings take place, along the highways where there are no public sanitation. So and I don't see this public sanitation or public facilities planning in the implementation of open discussion. This is just focusing on transparency.
Sorry for this interview, but when we manage the sanitation, I wish more guidance. If you can go to that slide, I think it's yes. According to this one, you only qualify to be safely and self-managed sanitation level if there's been emptying of that containment point. But from the guidance that we got yesterday, they make the note of this. You say, ideally, as long as maybe the response is, this toilet has never been emptied and it's not overflowing, it is safely managed. So I think before we go to that committee, we need to agree, otherwise I'm seeing some parts. No, the issue is, I'm saying, according to the definition here, that situ is those village toilets. You get it on site. But a situation in a town setting, I have my septic tank, it has never been emptied, and it's not overflowing. So from the guidance we got yesterday, the other day, it is safely managed.
Yes, yes.
Is it?
Yes. It is still, it's until further notice.
As we talk about safely managed, I want to point out for B and C. Like for instance, C mentioned it's connected to a sewer system, and there is one data point missing. Because the question for safely managed is what happens with the wastewater? Is it properly treated? Yes or no? Like, is it really up to tertiary treatment or not? So that's, I think, a factor that would need to be taken in here, and households are connected, multiplied by the ones or by the volume of wastewater that's indeed safely treated. The same for B is here it refers to has it been emptied, but not whether it has been treated afterwards. So also there you may need to introduce a modifier and not only looking how many pits have been emptied and sewer connections, but also what happens with the fecal waste afterwards.
I think I allow me to disagree with you on that, because when we are looking at safety management, we are looking at the facility itself. But let me give us a scenario. If you are living in an apartment somewhere that are connected to a sewer, where you are, you use the toilet properly, you flush, the contents get into the sewer, but along the road, the contents get spilled on the road. And that may be a temporary situation. Of course, we can qualify you as having openly defecated because the contents that you came out of eventually went to the roadside. But the facility that you're using qualifies to be a safely managed facility.
Can I respond to that? So the facility you are using qualifies as basic services. Basic services looks at the user interface. It looks like, do you use an improved toilet, latrine, and so on? What we described would be an improved toilet facility, possibly not shared. So you would reach the basic services. To be safely managed, there needs to be data supporting that the fecal waste is going to a treatment plant. So that's then all the factors about containment.
I agree with you.
So it wouldn't count as safely managed if it goes into sewer.
Yeah, now that is a temporary situation. I gave that as an example. In that situation, and we have so many of these sewers, when you look at the storage system, like in most of these developing cities, once in a while, they spill, and the contents may not reach the sewage treatment plant once in a while. Now, would we now consider all those as basic sanitation just because from occasionally they spill? I think no. Maybe the context value. So likewise, if I have a particular treatment and it is expected to be used
up to a point where once it is filled, it is simply covered with earth and the contents are treated in situ. It qualifies to be safe and managed sanitation facility. I hope we are clear with it. And that's the definition. And maybe the context is different. Maybe the context is different.
So, I mean, the way the JMP monitoring system works is we will look at the number of, like the percentage of households with sewer connection, percentage of households with septic tanks, and then percentage of households with latrines. But then only the ones that are disposed of in situ, emptied and treated, and the wastewater treated would count as safely managed.
So the ones that we usage consider to be just basic because the contents are not removed and treated elsewhere.
No, that's disposed of in situ, that would count. Yes. Ideally, we would have sector data that tells us how is contained which percentage of feces just buried are indeed safely managed, because you may want to deduct areas where toilets are flooded, where you have shallow groundwater and groundwater use. Maybe as a country we decide, no, that's not safe. And if we have a number, and Uganda tells us, look, our best estimate is 80% is safely contained, we would use this 80% for making the estimates. Like any numbers, any information that is there about what percentage of in situ disposal, what percentage of empty latrines are actually treated, and what percentage of wastewater reach the treatment plant will be used, and very welcome for different estimates.
Okay, any other submissions?
Yeah, it is just a general comment. I'm going to the principle of data collection. One, it should be easy to collect and should be easy to interpret, because right now we are in this room and we have different interpretations. Now when we go down to cascade it to the VHPs who are going to collect the data, the interpretation will be as many as the VHP. So when you are taking this information, please make it as simple as possible, easy to collect, easy to interpret.
Thank you very much. Just want to respond to what Nene has said. What we inquire whether this data collection tools at the village level, whether in English or they translated into local languages, because that is important. This is what can confuse us here about our VHTs. And we know, yes, the VHTs are a whole mix. There are those that, yes, they can do it and write, and they understand English, and others are good opinion leaders within the community who may not go at length to understand these details. So if this, and maybe at some point we may even need to involve some visuals to say if this is the type of the toilet we are talking about, so that they look at it and they're able to relate to what they're seeing in the pictures. Okay, yeah, this is a pit latrine, this is a pit latrine with a slab, this is a flush toilet. I do submit. This is It's only a couple of things.
So thanks. Your comment is perfect. It's convenient exactly at the right time. There is an experience in Madagascar. They prepared a little booklet for the enumerators to understand what is a tree, what is a VIP, what is accepted, agreed at national level to help collect the data together. And this is good for the sector, for the line ministries, when you send the information to the local government, but also for you guys to send to go ask questions with the enumerators in the field. That's a very strong recommendation that you could do. Once you agree about the different level of or types of infrastructures, make a little descriptive with pictures, so people, it's not the question of language, it's visual. Very good.
Let's move into the simple identification. What is our force on this? Share. Yes.
Thank you so much. My only comment was making up the assumption to also include those who are sharing. Because now the way it's stated, it seems like all those who don't own sanitation facility, we assume that they are practicing identification, yet they might actually be sharing the facility. So my recommendation is all households without sanitation facilities, all households without sanitation facilities, but we also include those who are sharing. And we don't count those that are sharing as part of this. Because the way it's stated, it means if I don't have a sanitation facility, it automatically means I'm practicing identification. If I could be sharing,
the understanding is that at some point, if you delay facilitating identificate, because if you don't have it, you share it, have a misunderstanding with the neighbor, then you also for utilizing it, what will happen?
I think it's a very valid point. And I think when Newport is asking households, what are you doing? It's only 5% that say that they practice unification. I think to have to distinct between sharing and unification is very valuable. I think it would be ideal to do it.
I wanted to comment about the calculation of this authentication indicator, that we have been just doing a difference between the coverage and 100%. But I think that does not capture very well the shared, the limited service. And we need to, because that coverage should include basic, limited, and improved. Yeah. The coverage figure includes basic, limited, and improved. Now together, and safely managed. Yeah, the coverage figure includes all those. So, We need to track the limited also. We've not been tracking it, we need to track the limited so that we are able to compute properly. That population that doesn't have their own facilities but are using some sanitation sample because they're sharing, and that just don't condemn them to identification.
And I hope that in the JMP,
yes, we do. But as a country, we don't have that indicator of limited among the three indicators. But although we know it is something that we are interested in, because they must all graduate to safely managed. Yeah. Yeah. So I think we need to find a way of including it. We need someone or somewhere so that we are able to do the mathematics right. And that might change the way we calculate, for example, either the coverage or the open defecation, so that the limited people are covered somewhere. And mathematics. Yeah, we might find out what we will reduce and the coverage will go high. Yes.
From those ones that do not have
and are not sharing,
if those who do not have are not sharing,
and identification. Yes, so we have to capture the ones that are sharing.
Yeah. That's right.
We'll take care of the limited.
Yes, mine is throwing a spanner in the works about open defecation. I think, as I commented earlier, for the urban setting, we are underestimating open defecation. We are only measuring sanitation at household, and then among institutions, we are only looking at schools. What happens when someone leaves their home, as it is the case in Kampala? Over 4 million people during the day come into the city, they don't move with their toilet. Now, how do we measure the open defecation, say in a city setting, when we are not looking at public sanitation provision, whether it is able to cover all the people that are coming into the city? So do we cater for that open defecation that may be happening in towns and cities? How do we measure that?
You're throwing this man.
When we say that if everyone tells you that they're using a neighbors or sharing, we count them as not practicing verification. Today is something very interesting. How many people are willing to admit that they're doing open defecation? How many people are willing to admit and say, I don't have, we are practicing open defecation? Somehow, somewhere, even those that are doing it, they will say, they walk to the neighbors and drink. So we need to have some very strict validation of such data.
Last, you want to say something?
I'd like to give a direct response. I think whenever it's possible to observe, like if there's any survey done, if the village health teams are checking on toilets, if they can observe, like if I can't say I'm going there, but goes together with the village health team to the toilet. So even if it's shared and they are bringing you there, they know where it is. I think you get already a bit better data. So whenever possible, do it as an observed and not as a just self-reported data point.
Thank you. I think for me it would be the numerator of the number of people, and I think somebody has just mentioned how many people will actually admit to practicing open defecation because it's for behavior change. But if you're looking at the number of households and you make the assumption that every household that doesn't have a sanitation facility technically is open defecating, so that you're looking at the number of households and not the number of people, because they could, and we've had this in one of our questionnaires where you're asking how many people openly defecate, and they'll tell you maybe the elderly or the small children. And then you go into the semantics of do they clean it up after or immediately? Is there someone removing it and things like that? And to be honest, nobody is, it's just a bit presumptuous to say that they actually tell you that every time the child defecates, we remove it immediately, which doesn't happen. Because I know there are also standards. Thank you for explaining a couple of our standards considered. So rather than looking at the number of people, look at the number of households and look at the number of households that don't have a sanitation facility and just consider that and make that the assumption that open defecation is happening. Because it's also the behavior changes. And I really think limited is common in training centers in urban areas where you have those facilities that are actually meant to be shared. But at household level, fishing.
And it is also possible that you could be having an improved facility, but you think it's not unification. Having a driving permit does not mean that you comply to traffic laws. You get it. If you have a standard permit, what are you doing? Is it about compliance with the traffic rules? Not because those indicators you're trying to measure the progress you're making, depending on what we want to achieve at the end of the day. So if you're trying to look at people who observe traffic rules while on the road, and you go by the measurement for you having a driving permit that is valid, you won't achieve that.
The big shape pattern related it. I don't know whether we've been doing a wrong thing, but here in Kenya, part of the element of observe and warm at the time you have visited. So visible distance in the compound and around the home identification. Even if your facility the other side is improved. So I don't know about that, whether it's something.
Yeah, thank you so much. Just to share some experience and also key observations we wanted. For example, the settlements in Karamoja, United settlements. And you find in the settlement there are over 20 houses. But you might find only 5 latrines in that house together. So you might not find identification in that market. So 5 latrines, 20 houses, where are the 15? So that's why we are saying it's good to capture not having and sharing, so that we are able to get a full picture of organization. Because how sure are we that really it's not happening? And it's worse at night. Sometimes because of variable rivers here and there, but also a lot of other practices. So for me, I'm more comfortable of capturing, not having, and sharing, because it gives us a true picture of verification. The other point I wanted to mention earlier is about the frequency of collection of this data. Like my colleague mentioned, that this data is collected annually. And we have had scenarios where you want to use the data at the district level. I think I mentioned this during the first day. and we don't see this data coming timely for use, but also for validation. By the time we are getting it from the districts at the end of the year, it's like, let's just give them what we have. So you are not to analyze the data across all the toilet map. You don't know, is there improvement, is there something? They just give you a figure. And so probably having this data collected quarterly, or at least by annually, and also help us to make decisions, but also to validate other than just waiting over here and getting this data the way it is. You really can't question math because you're also supposed to report, but I feel like the frequency could be better. It allows both the district guys, but also us on the national level to be able to see how are the trends. I know, of course, the costs and other things are there, but at the end of the day, actual issues with that are never achieved anyway. That's why the digital system comes in handy.
Yes, thank you so much, all for your contributions. And Loretta there has a question. Okay, do you want to say it before I say mine? Just considering this is JMP and you're reporting global figures, and you say you can contextualize it, fine. But if Uganda is reporting improved as not shared with a washable flow, and then Malawi is reporting improved as maybe just a substructure, then technically the improved is different across the board. So you cannot say that maybe 70% of the population actually has improved sanitation if it is defined differently. So I guess for me is, yes, we are looking at these indicators, but to what level can we actually change the definitions and contextualize them? We could report the national numbers, but that means at the global level it will still be different because you're using different matrices to measure it.
Sorry. It's a good question. It's very important that we need to clarify this. For the JMP is comparing countries with exactly the same definitions. Now, nationally, and it's written in the SDGs, each country can adapt the SDGs to their own, it's an interpretation of the SDGs to their own situation. And if they're saying that this is too high, we can reduce the level of services. And this is what's happening everywhere. But the JMP is comparing countries using exactly the same definitions, whatever it is decided at country level. It's very important, and that's why I was saying it's very important to make sure that at country level there is harmonization between the different institutions, but still report on the other levels that are to align with the JMP. So you can say this category of latrine is Burkina Faso was saying the only latrine that they were recognizing was VIPs. That's all. The latrine with a slab, for them it was not sufficient. That was a political decision. It's okay. But the JMP is looking at latrines with fans. And the statistics office was looking at all these levels, and the JMP was reporting with the latrine with slab as considered improved. So there is a difference. So in a way, it makes it a bit more complicated. At national level, there are some results referring to the national definitions, but also we can see that referring to the international definitions, it's a different level, with different results.
Here? Yeah. It makes it more complicated, for sure. But the JMP is comparing countries with exactly the same definition.
I want to comment about the issue of having a permit and not using it. Really, as a sector, we may not be able to observe for using their facilities, but if somebody has taken the trouble to invest in a facility, we want to believe that they are using it. And that's how we are able to measure, really. We may not be able to do the observation and the practice and all. So as we go into all this, we need to be cognizant of the fact that we have to find ways of easily measuring these things and understanding them and being able to speak to them. So we know that sometimes people still don't benefit even when they have facilities, but those are outliers. Yeah, there will be outliers out there, even if we standardize to the extent possible. So we are going to take a normal distribution, it is no mathematics. But that's how life is, that there will be some outliers on the side. Those easily follow, but we take the main. I'm sorry.
So, I think that our time is fast spent. I'm going to suggest that we stay and complete also the water indicators so that when we step out for lunch, we actually step out for the weekend. Is that agreeable to all? Yes. So Mr. Kiberu, please get ready. And in the meantime, I'm going to also give Jane to make a very small comment, but I'd also like to recognize the presence of Mr. Kauta Samuel, Assistant RDC. Thank you so much for joining me. Your time will come.
Mine goes to DK. When you say that they use the definitions, does that also automatically mean that they look at the indicator should also be like aligned? Is that possible? Can you find that in East Africa? That you have the East African countries with the same definitions and also similar indicator parameters, not just the indicators, but the parameters. Is that possible?
Oh, sorry. So, yes. We come back to the SDG definitions, the target and the indicator. And this is what the JMP is monitoring. And they're looking at the different classifications that are considered improved, not shared, and the different levels. It is what the JMP is looking at. They're not looking at each country definitions or each country strategy. It's really using the same thing. And the statistics office are encouraged. There is a coordination of all statistics office, and there was a lot of work done by the JMP to communicate what should be included in the different categories. So that's why there is a kind of harmonization between the different statistics office to report for the NGG, for the JMP. Is that clear? And the GLAAS, and that's something different. The GLAAS is going to ask, what is your definition? What is your target at national level? That can be different than for the global level. And that's a difference.
I think this conversation will go on for a long time. Let's try to.
Good afternoon, ladies and gentlemen. We are going to look at marathon, although we are not going to compromise the purpose. Can we go to the next slide? Next, this is just the mandate. Now, basic water. Percentage of population using improved drinking water.
That is the basic water supply, which is denoted, which is calculated by the total number of people in a water supply system, the water supply location, divided by the people supplied, divided by the total number of people. And that one, we are saying we also, whatever we're suggesting, we can accumulate this. We can do, this is water supply system 1, this is water supply system 2. You can do what happens at the village if the water supply system is more than 1 in the village. What happens in the parish if it is more than 1. So the total number of water supply systems can give you the percentage coverage, which is basic water coverage. So it is A over B times 100. B is the total number of people in that locality. A are the total number of people served. Yes, it should be B over A. Yes. Yes. Can I request someone change it for me? Yes. Someone there wants a hand. Already. Yes.
Yeah. In terms of basic water, we have that the time element comes in, or it is not considered within 30 minutes.
When we talk about the access, when we talk about this and the other one, then we come to what we can call access. But as we are also considering the functionality, there is that element of the time. Shall get there. Are we at par? Okay. Let's not.
Just go. You'll have many more questions at the end than now. So I will clarify it now. For instance, the improved. If you talk about it now, what constitutes improved drinking water source? Here.
Now, improved water drinking source in urban is a piped water supply system. That's all. And why do we say so? Even the law tells us once you construct a piped water supply system, put hold other existing like boreholes in that locality. I think we should not go deep into some of these things because that one is a law. It's okay. We might not. Maybe we are not practicing.
So point water sources like boreholes,
yes,
are not among the improved.
No, they are. What I want to note is, do you want to mean that where there are point water sources, we should not put piped? No, because the pipe also reduces the distance to the 0.2 kilometers. I think we should not go deep into this thing. We go into the 0.2 kilometers, then
Many other areas now point water sources.
yes,
And they are up.
yes, but he says what is improved in as far as urban is concerned, the piped water supply system is improved in as far as urban is concerned.
So for the purpose of this meeting, Mr. John, I'm a participant, I'm not with you in your urban department.
The participants can contribute.
Yes, that's what in the future side, that's what is done, but I think this is the purpose of this meeting. So don't kill the debate. So we have to move forwards into our system and begin to ask ourselves and see where we need to change. Now, I've personally been questioning the same thing. There is no, even Kampala, for example, Kampala is a city where we have sort of invested almost everything. So you make an assumption that everybody gets water from piped water in Kampala. But the statistics are very different. Over 30% of the people in Kampala are using water from alternative sources, from the boreholes. Now, even wells and whatever it is. Now, 30% of the day population of 4 million, that's almost 1 million. So you cannot completely ignore those kind of people. Now that's in Kampala. When you go to all other smaller towns, there is no one particular supply system that we have that covers the entire country. So you have almost 30% of some people who are using alternative sources. You're right. The reason we don't count them is because we are not doing any work. That's the cause of the disparity of the information that we get from Ubos. So Ubos count people have a borehole nearby, they get water from there. And if a borehole is safe for someone in rural, then it's also safe for someone in town. So there is a point there which we need to put table. Yes, we don't have a solution to it, but we are writing as a challenge, as a limitation in our data, and we get advice from what we can do about it going forward.
Okay, a deep borehole is also another safe source.
Yeah.
To a certain discussion, a shallow well is not a what?
Yeah.
It's not a safe. Now, that is the end. I didn't want to go into the safeness and the unsafeness of shallow wells.
Are you asking yourself? Just one question. I think we need to,
as a participant,
we need to appreciate that for us to achieve access to safe drinking water, it has a combination of other parameters that we need to look at. For it to qualify as a safe water source, then the water quality should also meet the minimum quality standards as published by WHO, about 97%. In this case, again, for us, we limit ourselves to E. coli, and we limit ourselves to the no. There are two water quality indicators that we look at. Yes, TSS. So those are the ones we look at. So as we are looking at that, it is going to be a combination of a number of parameters for us to achieve what we are calling safe management. So we want to appreciate that there are also other sources, but our limitation is largely how do we capture information from those other alternative sources? Because as ministry, like rightly said by John, we are focusing on piped water supply systems. So we will expect information to be reported based on how far this piped water supply system covers a given town or a given community in that regard. We appreciate the gap and we need to think through on how this gap should be bridged.
Safely managed. Are we there?
Yeah, to add on what Abdul has presented, among the shallow wells generally saying that we agree that they are not safe. I don't think as a ministry we have that statement removing them from the database that they are not safe. But what we have to look at is to look at the quality of that water. We know the percentage of the shallow wells, biggest percentage is not safe, but currently we cannot completely say that shallow wells are not safe. Much as we have put a hold on constructing them with government funds.
That's very good. It's very good, but just said, we have the data to say that. It's now something again, and I'm sorry I'm pushing, and she's not here today. Again, you have another source of data. It's GLAAS. They do look at other sources of access to drinking water. They do have data. Let's look at that, compare, and you need to work together and also GLAAS in some household surveys in the HS. I don't know if you participated in this. Did you check the water quality of wells? Yeah, so it would respond to your point. If there is some data about the water quality of wells, it would help to decide politically that's not improved or it is improved.
Again, I mean, just for consistency at the global level, I think we'd be careful in reclassifying types of drinking water sources into a different category than proposed at the global level. Like ideally, yeah, there is surface water, then we have unprotected wells, unprotected springs as being unimproved, and all the others considered to be improved, but not necessarily safely managed. And I think that's why this additional service level came in. Like all improved water sources generally provide water that is non-turbid. It's possible to treat it at household level. There is a certain level of infrastructure that was put in place to protect the water and make it safe for consumption. So I think just to try now, ideally, I think to move drinking water types into different categories would then lead to more disalignment later on, and there may be other ways to address them in the national monitoring.
We seem to be okay with basic. We move to certainly managed. Some people like Marika have started safely managed, which has a composition of, for us to declare safely managed, the functionality. That means this water should be available whenever and wherever needed, where you consider the reach where you can get this water. We also look into the water quality. This water must be safe and clean, but also the water should be at streams. So the functionality is a percentage. And we shall see when we get to functionality how we calculate the functionality, the water quality, and the water and premise, which is A times B times C. Look at the document you have.
You mean this one? The guy?
Now, that is the baseline. We are saying if this is it, what do we do? The lowest percentage of what?
Because you want a household to have all the three.
Yes.
You have 20% functional, 30% water quality, and 50%.
Then we take the 20% of the function.
20% of the functional, include that water and.
Yes,
Let's take the right explanation. So we would establish what is not functionality, but availability. What percentage has water when needed? Quality, what percentage has safe water without E. coli and hereditary chemical contaminants? And then the last one, accessibility, water on premise, what percentage has water on premises? Then we will take the lowest percentage out of those. The reason is that the joint monitoring program draws data from different sources. We may have quality data from the sector performance or the program performance reports. We may have function availability and accessibility from UBOS. So we have different data points, and so it's not easily possible to merge them to see what household actually has all the three at the same time. So it's a simplification for consistency of how it's monitored, or how the results are presented.
Okay, agreed?
So, the argument is that you consider the lowest cost.
Yes. In fact, I had some time with him when he presented. I personally had an issue with. He can justify. I talked to him on WhatsApp. Now, so that is the agreed position.
The lowest percentage.
The lowest percentage.
On water quality.
Yes.
Let me share the issue of looking at the bacteriological contamination and
yes. Yes.
And there are the water quality parameters beyond those, you know. Come again.
Yes. So in this regard, are those two adequate to say that this water is of quality, or even others may come in? I appreciate that looking at the bacteriological contamination is, yeah, if you're tracking that, then you're sure that our population is protected. But what about the other? If we group, I don't know. Water quality. Issues of the taste, the color, the water.
Yes,
Yes.
From a regulation perspective, I also had the same thing.
And I kept wondering whether these two are adequate. But the technical people think that these two are what will cause a serious public health issue if you consume. Now, the others would be basically from a consumer's perspective, what conforms to their preference. Maybe the color is not actually good, but the quality is very okay. If someone used the water, they will not have any problem. There are issues to do with the stability, of course, as much as possible, those can also be. But these are assessments that we do at the point of inspections to try and appreciate, and also customer satisfaction surveys. But what is usually done in the laboratory, those two that we look at, I just wanted to contribute.
Well, thank you all for your contributions. Mine is also in respect to water quality. I think it is very important that we also delve into discussing the different water treatment options that we have. For example, in the case of chlorination, it is important to monitor chlorine levels in water in the entire supply chain, from the point when chlorine is applied to the water and the water systems, up to the last substance that gets water. And this is done through something called the FRC, the Free Residual Chlorine Monitoring, because it is preempted that even at the point of drawing water from the last substance, if those levels of chlorine have gone down below 0.2 milligrams per liter, and then chances of secondary contamination is very high. And so the water loses quality there. So as we discuss this element of water quality, let us look at the treatment options that we have. Example I've given is the one for chlorination, because it is widely used everywhere, across board, in the urban centers, in the rural centers, in the refugee settlements. Chlorination is the preferred choice. But chlorination, when not monitored across the supply chain, it means nothing. Thank you. What do we take on that? He has said that we need to continue monitoring the coordination levels of the wet water supply system. But as we talk about that coordination, I don't want to be an expert here. My boss can talk about that. You know, where do you categorize chlorine within the 7 elements of water quality monitoring? Can you put it somewhere?
Just a calculation, yes, we take note.
We try to put what is the basis, the same level of the single chlorine system. And yes, if the water is taken within the 1 month, within the 4 days, 24 hours, it can be a reason that beware. There are different issues, but this room can be assumed to be well. And we will, as part of the regulation, said you can also do more issues to monitor the network, but we start with let's say smaller targets first. We just take so what can be achievable. So measuring it for the system could be good enough at the trade insurance provided. Just a small correction, but the regulation say yesterday we know this test and all parameters that you talked about, everything. If you wanted to do a full culture, something you can do a full test for all sorts of contaminants, but it will be very expensive and expensive. So we take one recommendation like this. The same recommends those basic tests that you can take. Once you take, okay, moderate, what Abdul said, what would the Bashir what we measure, the take of the equal line. 90% of the equal line quality is actually harmless. It's harmless. We are taking that cause condemnation. So the small 5% of the equal line character that actually causes sickness. But we use it because it is a very simple indicator, it's very simple to measure. And once you detect the equal line, the assumption is that you have human contamination. So with that presence of E. coli, it shows that yes, you will have antibiotics, they have come through the lipo, you will have whatever, all sorts of other antibiotics, you will get them. So just that shows that when you see that, it's a red flag that there is a possibility contamination has happened. If you see the hardness or the chemical contamination, then again, just a small one of them, then that's an indication that you probably have some industrial contamination. So we use that as just a simple measure to measure continually. And once you are detected, then you start doing the details. Okay, where is this E. coli actually coming from? Is it coming from the cattle or the neighborhood? Is it coming from this? Then you take solution, but they're just indicator and measures. And for routine maintenance, considering the costs involved into these areas, I think it is fair okay to continue with that.
So we've agreed that we continue with what we have.
Yes.
Yeah, I just want to comment on the water quality monitoring being carried out routinely because with climate change, to build resilience and also to monitor what are the likely risks that are encountering our water sources that people are using. You have to keep monitoring the water quality. So that you can put remedial measures in case maybe the environment changes have caused maybe contamination to our water sources. I think it's very clear to keep monitoring that indicator.
What's that indicator? Richard, what indicator was that?
So can we show something?
Yeah, so mine is probably just to seek for clarification. So as of water quality, is it at the point source or is this household water as where the samples picked from? Probably that can also support some of the discussions which are ongoing around treatment, chlorine and the rest. Is this picked at the source or is this sample from the households? Or both?
The answer to that is that I think that's the policy response that we are getting, where we are saying, trying to get information, cross-examination, and see where we can improve. So from mass water, traditionally, we measure at what we supply from our sources, and once in a while, we also measure among some public points at the source. UGOS measures at the household, what they find in the containers at home. So the problem is that, yes, the contamination can be from source, but that's goes to our data part, we take note. These are some of the recommendations we should carry forward and say, yes, we should do the measurement, the measurement in a low levels, one, and the treatment as you send the water out, but two, along the networks, as he has mentioned, is it working in all some good part of the areas along the networks? Three, at the household level, so we congregate and we have all these, and we can be able to track and measure it. But for now, we have not been doing beyond what after we have supplied. Not so much.
Percentage of villages with source. Percentage of villages with a source of safe water supply. We have two parameters, the total number of villages with an improved drinking water source and the total number of villages supplied by the completed piped water supply system. This one comes because when you do a piped water supply system, when you complete it, how many people, how many villages has it supplied based on the total number of villages with improved drinking water source in that locality. So we calculate it by A over B. I think this is a mistake. It should be B over A. And that mistake is carried out from the source. I think that document also has A over B, if we checked.
Do we need to continue what I said?
We need
to find that B. And a subset of A.
Yes. I think during the data capture, we need to capture because it is the somewhere the fountain of honor will always. I know when we submitted a report sometime of the A
is implied on this.
It's the in B. We've been moved. And the other one, for example, how many in a town council, for example, how many villages have a safe water source? In that same town council, when I do a piped water supply system, how many villages does this done piped water supply system serve?
But the other one is total number of villages and then
Yeah, in this statement, B is part of A.
Yeah, so why? Sorry, John asked, we are trying to make our numbers good by B, but B should be a total number of villages that we have
in that area.
Total number of villages. In urban areas, we have 50,000 villages.
Yes.
That's what we donate the food store.
Yes.
How many of those have water source? And improved water source. Yes.
So that is at the higher level.
That's the one we should, that's the one that makes sense.
Okay.
So that one is at project level.
Do we agree?
Yes.
Those that have the available villages.
Yes.
the difference between that indicator and the one that I think is really funny now. So no one does look.
It's the same, that's one, some are in areas, some are in urban, some are in rural areas. It's one, so that some villages will, the urban areas put themselves, but there are villages at the end of the day. Yes, we just have one people have 74,000 villages in Uganda. 20,000 or 35,000 are in urban areas, 40,000 are in some rural areas. So we measure along those lines. In your geographic area.
I just wanted to emphasize that this is a localized indicator because many people may be saying, does JMP measure this? The idea is, as we look at Vision 2040, we want to track how our efforts are spreading through the entire country. And the entire country should have access to an improved water source. So in this regard, we want to track and see how many villages have access and how many are remaining to guide our investments as we tag along. So it is a localized indicator. Yes.
For equity.
Yeah, and for equity, and so the assumption here is that if a village has a safe water supply in it, it is presumed that everyone in that village has access, right?
Yeah.
No.
For that, access in different, we are counting villages that have a source. That's our indicator. So that eventually we want every village to have a source first. Then we start to say which ones are big, which ones are small, which ones should be added. Yeah.
That's why we are measuring the two. That's why we are measuring the two together. Only one. So coverage is measured with that too. But we have it's a political pronouncement which makes sense. Of course, it's something to bear that say that at least everything that we call a village, every see one person must have a safe water source in his area. As whether it's outstand, whether it's a borehole, whether it's a spring, as long as it's safe, anything, just one. And then we shall start from there.
Can we move on? Yes, right. Functionality. Percentage of piped water service availability. And then we look at it as the number of days with water available in a distribution network versus the total number of days in a year which is very different. And then we look at the functionality at the spot check. I decided to go to, I don't know what this village is. If I went there today, this is Nalufenya. So if I came to Nalufenya and there is water, then I count that one as when I checked, there was water. When you go somewhere and you find at that spot check there is no water, then there is no water. So how many of those days where you found that water was flowing versus the 365 days? That it is measured, the functionality is measured one at the source. Now the data you collect at the water supply system in our jurisdiction, in our operations, then you'll find that data is also accumulated at the 6 regions of the umbrella organizations. So you'll find that umbrella organization in Chenjoju, what is your result on this? In Karamoja, what is your result on this? Then after that has been sent to the headquarters, then we now have the national what? The national figure.
So why ask at what level it's measured? Percentage of piped water service availability. Are you asking the household or the utility? So there's the aspect of rationing. village A will not have water today, but village B will have water, and they are getting water from the same system. So how do you measure availability on the day of the visit of two different households in two different cells getting water from the same pipe system, but one is rationed and the other is not being rationed? The system is functioning. It's just rationed.
When we assume rationality at one supply, are we assuming rationality, or we are saying we serve via the rationality being a consideration?
Is that for me? No.
Maybe in addition, if I go to some media, because we are in that, there are 65 days. In my group, as for the 100 days that have passed, for the so many that have passed, have you been having water or not? Was this transfer or not transfer? I'm going to look at the part of it when you're trying to establish status of this indicator.
This indicator is just as complicated as that, but what we look at, of course, for the so the two questions are related with the neighbor. So what we check is what from the records that we have from the entire water supply system. If they have days that they reported where they were not functional, that's why we take. Then we follow that up with a spot check. Make sure, okay, we have reached, the water is flowing in the town, okay, that's a tick. Then two, we look at the records of the 365 days, have you been serving all the year? And if they have some years, they then mark the days that they say they have not been servicing. Now the challenge is the practical problem that Diana has raised, which we need to work with the regulator and try to see how we factor it in. It's true, they are following the records, the system will be running, it has been functioning the whole year. So it's quite limited. But actually, not the entire town. Today, Kalero is off, tomorrow, Tina is off. Now, that one town is not in, we don't have that segregated to that extent. So, we only check and we compare the system. So, we did have to see how to put it in. I don't think any scheme will score a high value. Because I also in Kampala, we have very many days, so we are really hopeful.
Thank you, thank you, Assistant Commissioner, for that. I think now, moving to her side, it will be trying to appreciate the magnitude of no water supply for those particular days. So usually you adjust. If there is rationing and people didn't have water for 5 days in a particular location, yeah, you want to appreciate and see how many people were denied their service during that time. So those considerations can be made, but all these are geared towards improving the efficiency of the utility itself. So the conversations may not move beyond, but they are supposed to guide on the efficiencies of the utility and improve the service at that level. In terms of reporting, we will simply just end at the point where we are saying in a whole year, this is the continuity of water supply or functionality of our water supply systems. Then the other breakdowns, a bit complex, because you're saying if people didn't have, if the system was down for 5 days, how many people were denied a service? If there was rationing and village A got and village B didn't get, so was village B denied a service or was village Y denied a service? Now, the other very big challenge that we have relates to resources. You might want to do this, but it may not happen at the same time, because deploying resources to move across the entire country to do that spot check may not be feasible. So you may have to apply statistical methods, and you simply sample, like Dr. put it. You can look at the records and see where has this been frequent and how do we follow up to appreciate.
So that's very critical. So it's an area which requires a lot of financing, and the financing that might not be available.
Yeah, the functionality indicator also appears in rural water. Only that when we talk about the number of days, here in rural, we talk about the water supply in the network. In rural, we talk about the sources. The total number of sources that are functional at spot check. Now, the definition of the spot check is the same. So the difference is the number of sources. So it is the denominator which is B, rather the numerator which is B over A times 100. Non-revenue water, percentage of water billed divided by water produced pipe water supply system. Like functionality, when we talk about pipe water supply system, it cumulates based on the number of pipe water supply systems. So we talk about the amount of water billed in that respective pipe water supply system, and then the amount of water produced in that water supply system. So that non-revenue water is for pipe water supply system X. How many are they? How much is this non-revenue water? In all the 1,000, then you can get the country cross-wide non-revenue water. Yeah? Yeah. What happened? The water that is not built. It is not part of the non-revenue because the purpose why it is not built. What is the purpose that it's not built? Because it is not going to capture any resource that is coming in.
Non-revenue water is a complex one. And I will invite people to look at the water balancing tools published by the International Water Association. You can look at that. So you will appreciate more non-revenue water. There is authorized, there is unauthorized. Now, when you talk about firefighting.
Sorry, let me interrupt you a little bit, just a little bit. I think that some of our members have started to say farewell. It's only fair that we allow them to express their farewells. Have you given us all the presentations?
Yeah, we have a 45 minutes presentation in a few seconds. Now I would like to express our, well, you can say it too, but it has been a wonderful workshop. And really congratulations to all the participants for all the exchanges, very constructive, very frank. It's really, really good. And I think that we're going to share the experience in Uganda with other countries, definitely. It's really, really good. And we wish you all the best for the next steps.
I'll say the same. Thanks a lot for having us. For the job modeling program, if you have any data sources, if you have any questions about the indicators, about the definitions, please reach out. Ask Marta for my email or do directly to the info at which exactly email. You'll find it on the website. Reach out and we'll try to support. Always there to listen what data there and what questions. Thanks a lot and have a great weekend.
Jenny, say hi to your people and thank you for everything.
Thank you, John. You might have to make some correction there. It is gonna be D minus A over B.
Sorry?
The non-revenue water. So it is going to be B minus A over B. For us to be able to get the proportion of the water that is not paid for. This water is put into the network. Yes?
The other one captured what I was saying.
Which one? Yeah, that's how it is usually. It's the difference between the water that we push into the system minus the water that finally reaches the customer, which we measure through billing, over the total volume of water that we push to the what? The customers into the system. So I think that is it. But the water balancing tool can help account for authorized billing. Yeah. There is authorized consumption. I was talking about the firefighters, where that is used. At times, they are estimated. National Water has gone ahead to install meters at some of the firefighting points, so they are able to know exactly what goes into. But in places where that is not there, they will largely depend on records from police on the firefighting events and how they have utilized that water. So usually when we get into non-revenue water, all those we tend to offset them. And we want to see of the water we have put in the network, did the whole of it reach the customers? And to some extent, this water reaches customers and it is consumed. The unfortunate bit, it is just not billed. So non-revenue water is bad for the utility. But for us, the consumers, it is not an issue because after all, that water ends up with us and we consume it. So it affects what we call financial health of the utility, because they will be losing revenue from the water that was treated and was put into the what? Into the network. So the reason we look at it is to try and look at how well is this utility operating. The other very key aspect is as we reduce non-revenue water, there is a level below which we get what we call negative returns. As you're investing in money to reduce non-revenue water, you reach a point where your investments are equal to what you are actually getting out of the benefits. So below that level, you don't need to do anything more. Otherwise, I don't know whether that addresses your concern and the others. Thank you.
Thank you. That's a comment. Yes. That a colleague from OPM, the figures you presented, in light of the lecture he has given us on non-revenue water. There's a problem with the figures that you presented on the water produced. And yes, I don't know where that was going. It's not exact because it is actually the difference. Only they look very good. They look very good. So the curves of the producer and consumed were almost like 95%. My assessment that what you're capturing there was only, we use some to produce water, and the treatment plant, we also use some, almost 5% of it. We use it in the plant for cleaning or backwash, so it's a normal operational practice. If you are putting the total non-revenue water that is done in the systems, that is a little bit much higher than the graphs that you presented. So probably we may need to review that graph and depending on the relevance of what it was supposed to be for. Thanks.
Thank you. Can we move to the next?
Yeah.
financial sustainability. Now, the financial sustainability in small towns is looked at as the difference between how much money does private water supply system collect versus how much is the cost in that same period that is needed or invested in giving out the service. So the difference of the two makes the definition of the financial sustainability, total revenue collected divided by, it should be total O&M cost divided by total revenue collected.
So when is it find that?
When?
1%.
At 1, at 0, the ratio. At 0, that means I have given out a service at the same cost I have managed to collect. If I've collected 1 million and I need 1 million to give this service, then the sustainability is at 0 level. 0 level means rather it is at 1. And that means if it is more than 1, if it is bigger, if I have spent less money than what I have used, that means the options of the system growing becomes bigger. So the less cost versus the more collection, there are options of this scheme becoming bigger because you have some little resources you can use to this very scheme to make sure that the scheme expands.
So that means we are ready.
Yeah, the ratio is, we don't need what?
We need a ratio rather than a percentage.
Now, this is either or. You can choose to have it as a percentage, and you can choose to have it as a ratio. Whenever this value is greater than 1, it means the utility is performing well because they are able to collect revenue that meets their O&M costs and make a surplus that we expect to be reinvested in increasing the coverage. So for anything greater than 1, that is very okay. Anything below 1, the utility requires a bit of subsidy because then they are unable to cover all their O&M expenses. There are also other indicators. He talked about financial sustainability. This is the basic one that we look at as we grow the umbrellas in this case. But now when we look at national water, we are looking at a different indicator. And in this case, we are looking at work ratio. Yeah, how much of your revenue finances your O&M. And in this case, we twist it upside down. What is below becomes the numerator, and what is the numerator becomes our denominator. And in this case, the less the better. Yeah. So if they have like 0.7, they are doing well. If they have 0.8, they are doing well. But the moment they move beyond 1, then we think there is a problem. Yeah. So that's what I wanted to contribute.
Thank you. Pro-poor, percentage of towns with pro-poor facilities where users pay less than the ones at the household level. This means how many pro-poor systems, how many pro-poor facilities are in a town. then how many towns are in that water supply service areas? If it is a municipality, how many rural growth centers and small towns are there? And how many of those have the proper facilities where we assure that the proper facilities at the proper facility, we are paying less than the one at the household. So that's where we talk about the two tariffs, the tariff at household level and the tariff at the proper facility. Is that straight?
Because of the definition of what the proper facility is.
What do you define the proper facility? Let's hear from this page.
No, I'm not providing the definition of a proper facility, but I think we all know that what we consider proper are these public units. You construct a kiosk and you will hope that this poor household, low-income earner, is going to come and get the water at that reduced cost, but they never do. So the only way, well, not the only way, but one of the ways that a poor household can actually benefit from these instituted policies is if they have their own connection. Because that way they'll be able to pay the reduced tariff. But at the PSP, it never happens. So the number of PSPs, like, we just need to change that one.
This one is a shared problem with all of us. You are our partners, we can't say this is part. We need to continue deliberating on and see what can do. That's it. We are doing that. As I said, I think the number of extending connections is the number one indicator which we push all utilities, how many connections are you grown. So what everybody to have, that's how we will get access to the low water. But as we do that, in the meantime, we also try to make a deliberate intervention where we say at least if the households are paying 50 shillings per jerrycan, we have a deliberate place where our charge is 30 shillings per jerrycan. It's lower than that. But the administrative issues, yes, those ones come in, and we have tried very many scenarios, but we are failing because of the administrative cost relief. In some other areas, they work well, but we have to, it's about money, it's from which pocket you pay and get paid the other. So in some areas, we are paying, but the government has to put the bill, but the umbrella person is paid, they separate extra salary so that he can provide the water at that shillings. But again, you still have to pay that person through your taxes, through some that someone will have to pay, because that's a challenge. There is an administrative cost for some receipt on a PSP to manage it. But we agree with you, it's really challenging. We are paying 200 shillings per jerrycan, which is not really our intention.
I'll just comment about the proposal set for Kampala. What National is doing is putting up the prepaid token standpipes, a number of them, and we've seen them actually ameliorating the challenge, say cholera outbreaks and so on. So, and presence of a public standpipe that is prepaid in a high-risk area, you see that going down. And also to remove that, if it's at a reasonable distance, to remove that going between person who skyrockets the price of a jerrycan. If the household themselves can go and pick the water and take with the token, they will be able to access it at the cost, the production or whatever cost that is lower.
It's working, but up country we are limited by infrastructure. All those, they all need internet access or something.
Even when you touch a card, you always find someone waiting for that amount to go there.
Yeah, so what's to be done?
Actually, that's the limitation. I was about to say, have prepaid infrastructure, you need a lot of investment into having that, which investment may not be there. Then the software itself and the operational costs are way high compared to what customers pay. But we as a team need to appreciate this. We are asking the utility to charge 50 shillings per 20-liter jerry can. And currently, I don't know whether it is me who stays far away and I don't see some of these denominations. But if you went in any local community, the 50 shilling denomination is almost absent. Then, when you look at 100 shilling denomination, it is also not easily seen. Then the other aspect is the operation of this public stand post. Who is there to sit for a whole day, and in the end, you're saying if you have sold 50 jerry cans, that's 1 unit. You're going, customers are giving you 5,000 shillings. And out of the 5,000 shillings, we are giving you 2,500. So they're giving that. So we found challenges where the operators now, together with the LC chair, sit, have a conversation, and they agree. And say for us here, for me to be here, be opening for you and the like, each jerry can is going to be 100 shillings. Each jerry can is going to be 200 shillings. But remember, in the procure strategy, we said a procure connection is that connection where a customer pays a tariff that is less or equal to a domestic what? Tariff. Now, when you go ahead to do some computation, the poor continue to pay more per unit volume of what? Of water. But how do we address that? Given that the poor are living from hand to what? To mouth. For them, they are paying their daily rates. Actually, the failure is not usually the customers, but the person that is operating a PSP. That's where the dynamic, where the real challenge lies. And the need for us to think about what other innovative solutions can we have in place of procure. And we want to appreciate innovations that we've observed across the umbrella utilities. They are saying, can we subsidize the connection fee such that every household, if they have their premise, they have water at the what? At the premise, and be able to pay for that connection over a period of what? Of time. Because this is not working out. If they all have a domestic connection, they will be paying that time. Are they able to pay in installments? The fact that they can't have the money at once given to the what? To the utility. So those are some of the conversations that we need. But by and large, that's how we are measuring the indicator.
What indicator?
At another level, we shall find ourselves when we talk about self-managed and self-managed premise. Now we say for poor at the station, at the junction. That one is another discussion. Some other day.
We're keeping it as it is, or after all everything. Are we keeping it as it is?
We are keeping it as it is.
For measurement's sake, but
for
measurement, we continue.
We can continue thinking about how better we can implement. We have two last indicators. For me, I'm going to handle the last one, then the second last, the regulator will manage. Can we move? Yeah. Now, per capita investment. For a piped water supply system to be constructed, it calls a certain value. But this certain value is supposed to be an injection to each and every person in the jurisdiction coverage of the piped water supply system. But also, we have a design period of 20 years of this piped water supply system. So how many people are we going to serve in the span period of 20 years? So if we are serving 1 million people in 20 years, and we have invested $1,800 US, now the per capita investment is that total value we have invested divided by the design population. Now, I think Doctor will come in and help me with the 75 span and the 120. You will find that in most cases it can be less than 75, it can be 75 as maybe a recommendation, but in some instances it can stretch up to 120. But we said, was it yesterday, that the smaller the population, you might find that the investment is big because the population is small, but there is ample need to give this area water, even though the design population is what? Is down. So that means the per capita investment will be up. I want to get that percentage.
I think it's so. There's no question to say. We just use it as an efficient, as a measure of efficiency in implementation. How adequate you are to, to implementation of just getting that you are basically efficient in design. And again, this one is largely just indicative, and we just use it. There are different ranges of investments that can be done. There are rehabilitations which come in at a very much cheaper process. There are new investments which may come in at more expensive. So we just look at it. If you implemented the project, for example, and you came up with a per capita cost to $180 per person whom you serve, you notice that this is higher than the average that we use. So we ask you to look at why, but there are several reasons which could be. It's a groundwater, it's a difficult area, there's no groundwater area in this area, how to get water from 20 kilometers. Okay, it explains why you are above. But if you did a normal system, which is the normal supply, the normal transmission length, then you should fall within that range of investment.
No, my question was not my issue was that the per capita investment is appreciated, but why do you multiply the per capita investment?
It is not like it's a mistake.
It's a mistake. It's a mistake. So the second, before that, the second indicator you did present about the management, this purpose of this meeting, regulation, do we really need to continue monitoring that? You need to talk about it. So I think we should remove it from our measurement framework. The number of schemes is a very redundant indicator now. If every scheme is already an average of something we have, so it always be 100%, everybody has.
Some people define gender as female and male.
Yes.
They badly need it. Yeah. Although gender is not female and male.
No, I'm talking about management. The management.
Go to
Previous slide.
Go to the previous slide.
The previous slide. Still need that indicator.
Previous slide.
And does it show anything? That one.
The first one.
Total number of 500 schemes with the formal contracts.
No.
So what?
Yes, so that's what we actually discussed here yesterday. And I was telling my colleagues that this indicator is redundant. Yeah, because at the moment, we cannot, it's leading us nowhere. In the previous arrangement where we had a private operator model and we have water supply systems managed by private operators. If you recall our conversation about 1001 water supply system,
each of them with a performance contract which you needed to monitor, a management contract in that case. So this at the moment might be redundant.
Is confirmed redundant. Delete.
What do colleagues think?
I want to delete, but it has a different.
I hope this is not a genesis of a gender perspective, gender mainstreaming.
It's not gender mainstreaming, Mr. Tiberu, but I'm looking at of course, I appreciate what you have presented. And like what percentage are we, if we are to look at the public water systems in regard to the population of this country? And when we look at management, why are we talking about management? Is it contributing towards the safely managed, the basic, such that it's contributing towards availability and functionality of the waterways? When you go to the other side, maybe also forgotten cousin, but this time is a forgotten sister and brother, we still have a community-based management system. And we feel that those structures are playing a great role in the management of these structures. So, whereas we are agreeing that under pipe water systems it will be redundant, but before we transit from CBMS to the real, more professional management should remain.
That means it should be specific.
No, my recommendation would be, we are sending to the committee, let the committee review. Let us find the, and you are saying you have a form of contract, so what? Has the Baghdad asked Bajiria? Bring the people into the contract. No. So it doesn't matter. So it doesn't matter. This is it. We are trying to, I think we are trying to say that a community-based management system is bad. No, it can be there. It's a water supply system. It is under community management system, and it is operating well. We don't have to change it. We don't have to take it over. We can maintain it there. But what is the indicator that shows that the management is working? That should be the indicator that we take. So, irrespective of which arrangement is being used, which one where it goes, whether it's national water, whether it is umbrella, whether it is community-based, whether it is under what, that's the management decision earlier. But we say that as part of management, what has indicator that shows that this management function is working or is being performed.
Thank you, Doctor. The last slide, everything we have covered is covered. But we wanted to bring out the element of the NDP3 here, where we have processes. Because during the NDP3 reporting, we were reporting on each and everything the way the last slide. Can we have the last slide?
Last slide.
The way this slide is, we are reporting on everything, but everything within this has been covered in all the previous. We just wanted to give information on the HCD in the NDP3. So I think for me, I'm done. Am I in the other side or this side?
Thank you for a wonderful engagement, and it's 2 o'clock. Yes. Yes.
I just wanted to mention that there are indicators that are supposed to inform. Sorry, we are regulating, but as part of the policymaker. So there are indicators that urban, rural will monitor to improve their management processes within, improve on service delivery, direct on investment. But there are also indicators that are there for us to look at how well are they So for example, if we have the area service model, we needed to have a customized kind of arrangement with indicators that will determine how well they are actually managing and operating our infrastructure as government. The infrastructure that we have entitled them to operate, are they operating them in a commercially viable basis to provide for the current and the future population? So they are technical, they are commercial and financial indicators. That's what I wanted us to appreciate because of time constraints. I don't want to dive into the details of which one we didn't look at, but we can always look at that even after.
So you will find that whatever we've covered, the indicators that also apply to rural water, the only difference is the jurisdiction. This one is urban, the other ones, but the calculation methods are the same. The way we saw functionality, the way we see per capita investment, so the calculation methods are the same. And in this notebook in this document by UNICEF, they tell us which one is urban, which one is rural.
Thank you, gentlemen, for your presentation and clarification. At least I think we all now have a fair understanding of what indicators we have, what issues there are with each indicator, and we have even suggested areas where the statements or the calculations ought to be amended. But this is not the end of the harmonization process. In any case, it's just the beginning. So we have to get that team, that committee, that group, which we propose would take this job forward, so that they have the documents showing the indicators as they are currently, with the inputs that we have generated today, and then they take this to another level and they will bring for us what they consider to be harmonized indicators. Of course, they'll also be mindful of the global requirements. So it's not an easy job and it's not going to be done overnight. We may allow them some weeks. It's a bit of work, but we're here to work. Yeah, we're here to work. So the committee, how do we proceed? What's the most democratic way to get this committee in place? The other thing that we want to agree on before we leave Ginger is the clearinghouse, the institution that's going to give us the leadership that we require in conducting business in this newly agreed and harmonized way. For me, those are two important things that we must finish. How should our committee be constituted? The representation, the people who know these things of electoral commission and things like that better than me.
First, we need to get representation from all the line ministries. And then so a member from all the line, like the different line ministries. Then UBOS, unfortunately today we don't have a member from UBOS. And then, she's not around, she was there yesterday. Then we have to get a person from the DPs, and that is UNICEF. And maybe we get also 2 representatives from the civil society organizations we are working with. Yes, USNet can help us nominate who to be on the committee. That's my suggestion. Thank you.
My suggestion is that we make it as voluntary as possible, depending on the expertise and the interests, is it what supposed to work. I think we've had the email where all of us are involved, everybody was invited, was participating in that mail. I would request that each one of us, please, if whoever please wants to participate into this, that being the minimum condition, kindly send an email and try to say which one you would best fit in. And as a presenter, we can, so far what we can agree on is that the two presenters are the two secretaries of those committees. They are the only confirmed members. Martin, you will have a salutation. John will take the consolidating the water. Then when they meet in together, we can have the leadership of the groups. I think that's my suggestion of what would be. But I wish to make a humble case. I don't know what it entails, whether it's about the administrative issues or whoever can handle it. I would kindly request if this committee or whoever this wants to participate in, it's a longer time, but let us do something almost immediate. As Ram mentioned earlier on, we are trying to finalize the NDP 4 process, which is going to be our 5-year implementation document where we are all going to put in. And the moment you capture some of these indicators into formal documents, the more, then you will have NP asking you to update on those very indicators regularly. It will also help us to streamline them and take them forward. If we stay with this and try to work on it and come up with it in December, it may stay hanging. It's not a document. So, and we have only this month, this and next month, latest to July, where we can work. If we can have input by the end of middle of July, would be really ideal to incorporate into the NDP 4 process.
Oh, we also get some volunteers today, other than the fancy and John. Some people might be ready already, so please feel free to shoot your hand up. Because I know, Commissioner, that when we go and say we're sharing email, you might be surprised. I wish I was sitting for it. So if we can actually get some 1-2 people who can already commit to work with John and Martin, who would at least start moving. I wish I could volunteer. But I can't. Think about it. So we have Richard already. Thank you very much. And Stephen.
With Martin. Those are all Martin. It's Kayanja with Martin.
Okay, Richard, you are with Martin.
John, you can have Diana.
Diana, yes. That is what I'm You'll be joined by some people who are not in the room. Like George. Okay, at least we can get some work moving already. I do not know very much about the administrative implications of this, but I think that people will be sponsored by their respective institutions, and the secretaries will find a space that can also afford us some coffee and sugar. These meetings ought to be oiled a little bit. Anyway, the committee will work out their logistics. More than anything, I think this committee will also agree on the clearinghouse. Yeah? I think we also give them the mandate to think critically and look around the sector and agree that this one agency that can provide the leadership is WHO. I'm not trying to bias them. How is that? It will work? Yes, that decision will actually go beyond. Yeah. Okay, thank you so much. The big questions have been answered. There is only one question, it cannot be answered now. UBOS. We had the question of how do we engage UBOS deeper, because it has been a key part of our conversation since we started. This committee should also devise some recommendations on how UBOS can really be engaged much deeper
much more frequently than we have been engaging them. Having got a team to start this process, I think we are beginning to see the end of our workshop. Is there anything still hanging? No. Please make sure if you did not sign attendance sheets from Tuesday to today, you make sure that you sign, especially if there's an important column. That column is very important. Okay, so I would like now to invite the gentlemen who are going to give us our parting words. I will start with Dr. Felix, and then Dr. Felix will take the honor to invite the representative of the RDC, who will give us closing remarks. So Dr. Felix, please.
Thank you very much, our very able facilitator. There are not very many people who can facilitate such a discussion up this time. People are still talking, otherwise we don't be sleeping. So thank you very much, that with you. But now that said, I know we are all tired and hungry for discussions, so my remarks will be very brief. It's basically to say thank you really to all of you for this active engagement, participation. Thanks to Martha and team who have collaborated and trying to make sure that all of us come and participate in one way or another. This is a very, very important subject, and as again, Lamu mentioned earlier on, we have sort of prioritized data management, reporting. In actually, we are calling it a specific intervention in what we are trying to write up in the NDP 4 processes. Of course, NPA should have said, okay, the same question as to yes, so what is that benefit to the community? But we are saying yes, there is the community wants service, they want water, but as an intermediate step for us to achieve our targets, we need to get our house right on these data and these discussions and these indicators. And the biggest challenge is what we are facing, this happening in important areas. So this is a good starting process. When I see the faces of all people here in this room, I was very more excited. These are the right people. They are not any other. There are a few people who are out in this room that will give us the answers to what we need. And the same place, let us open up thinking. We take the advantage. It's a new discussion of the NDP 4. It's our turn now to put our foot down and say, yes, we have deliberated. We have seen the pros and cons. We have seen the experience we've done over the past 15, 20 years of using it. But we think we should change this. It's not casting stone that a board must serve 300 people. No, it didn't come on the Moses laws which came down to us. It did not come. It was put by men like you and I, based on the circumstances and the information that was prevailing at the time. So if you think now is the time to say no, we have been making a mistake, I think maybe this has been overtaken by events. We need to reduce this to 200 meters. We need to reduce this to 800. Justification, kindly put it forward, and we deliberate it. We put it through the structures of our leadership, and we approve it and we adopt it. Say going forward, this is the area that we're going to go to. Finally, thank you very much to IRC and I think SHM who have provided the funding, water for people, and through water for people. And everybody else, who has contributed and made this happen. And we pray that, as I have been saying, that this is out of the course. It's really a very important aspect. I pray that this will not stop here, this will not be the end of it all. Our discussion in India, we can be able to track it. I know that's why I like to work with whatever people and Jane and IFC. These are household people in us, so they are not going to take a flight also and go away and live at this time. No, this is something that we are going to continue building on until we have something that we are all comfortable together. So all of you, whenever we are called upon, can be participating and let's put in, and we hope that the next time we'll have more participation of other DPs and other even local governments who are also our service. We are discussing loans and support services. but the one who brings the service is the person at the local level. The local government is the big person for that. So we also have to engage you to do this and be part of us. So thank you very much. Thank you all. Good afternoon, and Secretary home and a good end to the current financial year. And with those remarks, I said I invite our most important stakeholders in this, our landlord, who has been hosting us for this whole week, but also a voice of the people whom we are trying to serve. Give us his parting shots and officially close the discussion. So thank you all.
Thank you very much, Commissioner. Officers from Ministry of Water and Environment, our facilitators, all participants, ladies and gentlemen, good afternoon. Since Wednesday, I came here on Wednesday, but I had issues at the office. The president of Uganda had invited my boss, so I was fully in charge of the office. So I had to come here and also go back to the office. Yesterday I was here, but the concepts were a bit hard. I had to make myself busy here and there. Then today, at least today they were a bit. Ladies and gentlemen, I know the physical appearance so that people are tired. When I came here on Wednesday, at least the board was a bit full. Yesterday it went on increasing. Today you can tell us. I'm Kauta Samuel, Assistant LDC, Jinja District. Ladies and gentlemen, I'm profoundly grateful to witness the closure of this workshop and also to talk to the learners of this nation. The discussion has been so interesting. Yesterday, we talked about, and even today, we talked about open education. And also we talked about competition between learners and the teachers. I want to assure that it pushed me far. Can you imagine a learner to compete with a teacher? And what are you going to tell that pupil after seeing you? Ladies and gentlemen, we have a lot to do. We have a lot to do. We talked about installing more piped water. In my village, first of all, I want to appreciate the government of Uganda, led by our Mzee, Yoweri Kaguta Museveni. And I know some of you don't want to hear about any other, but that is it. In my village, they gave us piped water. After 6 months, these pipes were nowhere to be seen. That brings me to mindset. Some of our people, they don't know how to use and the importance of this. They are used to Vidiba water, and for them, they are very comfortable. So when you bring this piped water, you'll have a lot to explain to them first. We talked about rates, payments. A village at my village can't pay water, yet the other water is there. You just get your jerrycan, you go there,
you get to go back and drink. They don't mind whether water is safe or what. We have a lot. And I want to urge that let us not remain here, but let us go down there and talk to these people. Some of them, they are used to us. When we tell them, do this, they will not, because always they are seeing us. But when they see new faces, you never know something somewhere, things will change. Ladies and gentlemen, we talked about uniformity of data between the different government entities and the local government. This is very important. And I want to argue, when we get this information, let us utilize adequately. You know, one day I wanted to monitor and supervise a certain road. I'm just giving an example, even though it is far from our topic. I wanted big choose from the engineer, but the man denied me. I had to show him that I am a man and I was appointed by the president of this republic. You know, that situation we don't want to reach there. If that information is there, please let us replace it. Give us that information, we shall help you. Ladies and gentlemen, I can't leave this place without talking about socio-economic transformation. Because having good water and utilizing it well, it means our people must be well off. Of course, poor people can't use this water well. So we have programs like a PDM and a NEO. But our people, they are also bad. I don't know whether they lack sensitization, but we shall do it. You give him $1 million, the following morning you will hear that the man has got another wife. Is that development? You give a lady, $1 million, that is PDM. The following morning you will see her dressing very expensive, you know, on her head. Then you wonder, is that development? So, ladies and gentlemen, we have a lot to do. Anyway, once again, I want to thank the ministry for organizing such a wonderful workshop. I know lessons learned will be of great importance to our nation. I've also been changed. Those few hours I've been here, at least I've got something. I can go down there and explain. Once again, I'm Kauta Samuel for God and my country.
Thank you. I think now lunch is served, but I think the ones that are left shall get an opportunity to take one last photo for memory's sake. Those that were in Ginger this week. So let's have a photo outside, and our photographer will organize for us. Okay, she's better than me. Or she says we can just have it out actually at the back of the room. And then we'll go and have lunch, and may you all travel safely back to your respective homes. Have a wonderful weekend. Those that are going to stay in Ginger, please enjoy it most. And thank you so very much for your God bless you.